scholar, graduated from College of Nursing, Bangalore, pursued a master's degree from Icon Academy of Higher Education, and completed the doctorate from Niagara Missions University. She is currently holding the post of Principal in Lakshmi Memorial College of Nursing and the specialization in Medical Surgical Nursing. She holds various associations such as Chairman, Board of Studies, Pakistan Ministry of Health Sciences since October 2021, Vice President, United Nations since 2020, expert in Doctor Advisory Committee of PhD program at Purdue University since 2022. She has presented papers and published articles in national and international journals. To add further to the gap, she won the first prize in paper presentation in International and National Oncology Nursing Conference 2003 Mumbai. She was awarded a prize by Icon University of Higher Education for securing first position in research in medical nursing during 1999 and 2000. May I request Ma'am to take over this.
Good morning to everyone. It is my great privilege that I am present here amongst all of you in this national conference where I have been given the task of presenting some concepts about qualitative research in nursing. So I think most of us are familiar with quantitative research. But when it comes to qualitative research, how many of us are very well versed or aware? So if you see the current scenario, qualitative research has taken great importance among the nursing scholars. Even the undergraduate students are taking up the qualitative research under the supervision of the supervisors in the colleges and even in the hospitals. Quantitative research, it has been present for some time and it is found to be somewhat easy when comparing to the qualitative research. So why it has gained more importance, before which we need to know what is it. So I have tried to put it as brief as possible with some understandable concepts, because when anybody goes through that, we may find it a little more difficult to understand. But we need to understand what is qualitative research, because that is the current trend that is going on. So 21st century is the most important phase that we are all in, where we need to solidify the evidences which we have gained through quantitative research. Even the third year BScs, most of them are taking quantitative research so that they can have a experience of doing the research. So what is qualitative research? So when you say anything comes with the definitions, which may be a little challenging one. So it is a phenomena, like a problem from a place of unknowing attempts. So many unknowing attempts which have been made. That means things which are not known commonly, things which are not familiar, things which are not understandable about many things. This makes qualitative research particularly useful when something is not much known. Most of us know so many things because we are exposed to the clinical area. So, but some things still we are not much knowing. In that area, the qualitative research plays an very important role. So it is developed as a reaction to positivist philosophy. There are many philosophies. One of the philosophy based on which the qualitative research is a positivist philosophy, which had overrun all the sciences, even the philosophy itself. Philosophy, when you say, it's a very vague term. So that's what is the main base for this also. So it recognizes the lived world of a humanity. All of us are living, all of us have individual experiences of the same thing at the same time. All of us may not experience it in the same way. So that's what is one of the basis of qualitative research. In the natural world, when you say natural world, as we are living at this moment, at this current context, that's what it is focusing on. If you see here, you can understand. What do you understand by this? Here somebody is saying use a mouse to open a window. So what is the person perceiving? He's going near a window and imagining that there is a mouse that I need to open. That's what he is perceiving. Many of us many times think like that. Literally we go into the meaning. If the patient says something, literally we go into it. We don't understand why he is saying so. So that's what we need to understand when you are performing the qualitative research. So it's a multi-method in focus involving interpretative, naturalistic approach to its subject matter. When you say interpretative, our interpretative level should be a broader one, for which we need to know much more things so that we can relate to the person when they say something. And qualitative researchers study things, that is, people and their thoughts. Everybody, all of us know thoughts are vague. It's nothing concrete. Today, somebody what we say, tomorrow we may say something different because it keeps on fluctuating as per the situations. But it is in the natural settings. Attempting to make sense of or interpret phenomena in terms of meanings people bring to them. So when I say you think about a rose, what comes to your mind? Rose, what comes to your mind? Do you think about eating or something about decoration? Decoration. Everybody agree with that. But some people may, yes, fragrance, yes. Some people may think about eating. Do you agree? Yes, but that doesn't come first to the mind. Among this audience, maybe one or two might have thought about that. So that means there is a varied thing about a thing that we perceive because we might have had some previous experiences or something we might have read or heard that makes us to think in that way. So that is what the meaning the person brings to a concept. That is qualitative. Certain characteristics like holism, putting together, subjectivity. That means what I feel, you may not feel. Subjectivity. Then situated context. In which context it is? It is not always. Rose is a flower. It's always. In whichever context you take, it is a flower. But sometimes all things are not so concrete. So it varies as per the situations. So this will guide a methodology one has to use when doing a qualitative research. So this type of research stresses the importance of studying each individual as a holistic system, each person. So if you say for a teacher, a student in the class, each person is separate. We may not say generalize, all the students in this class are very bad. I think many times we as teachers, we make these statements. Your batch is very horrible. Is it not? We have the tendency, as a teacher, many times I might have passed these statements. But when you study each individual as a person, as a whole, the interpretation may be different, which is influenced by the situated context, the subjectivity, and the interactions, which you call it as intersubjectivity, and the situated context. So what are the frameworks for qualitative studies? The main goal is, it is not hypothesis testing, which is what is the focus of quantitative. We don't go to test the hypothesis. And it is used in different senses in qualitative research. And each type of qualitative research is guided by a particular philosophical stance. We have some broad area, but each type are governed by different things. So what is the purpose? If somebody wants to do a qualitative research, you need to see whether any of these are your purpose. Like whether do you want to describe something, you want to understand something, you want to explain something, you want to identify, develop, or generate something. If any of these are what you are thinking about doing, then that is the purpose. Then you can go and do a qualitative research study. So what questions can a qualitative researcher best answer? One is the lived experiences. Is a common terminology a qualitative researchers use. If you read articles, you get that. Qualitative research is lived experiences. Insider perspective of reality, which you use the terminology called as EMIC. Insider's perspective. That means what I feel, not what I see, what I feel. So that means interpretation of the data from the perspective of the population in the study. Whoever you are studying, if you're studying an MI patient, if you're studying a woman undergone hysterectomy. So from that perspective, what is the reality that you are coming across? So this is a context-oriented than measurement-oriented, means situation. It is not how you are measuring things. So you use the paradigm called as an interpretative paradigm. That is what is used in qualitative research. That is, the researcher should explore socially meaningful actions through the direct, detailed observation of people in natural settings. So a researcher has to go to the field, observe and get the first-hand information in a natural setting in order to arrive and an understanding and interpretation of how people create and maintain their social world, whatever the world it is, whether it's a hospital, if it's a student, or in the community, whichever it is. So we use methods that try to describe and interpret people's feeling and experiences in human terms rather than quantify human terms. Sometimes when you get the results, some students are very elated, they jump. So what is that expression that time the student feels? Patient get admitted first time. How do they feel when they, for you it is a routine. But for a patient, first when they enter to the ward, how they feel, that statement, if you can capture that, it really gives you a very great understanding how patient feels. That's why we say it is in human terms rather than your quantitative. 10 people felt very sad, 10 people felt very upset. It's a generalizing thing. But one person, the statement, what they feel, that is what you are having an interpretative paradigm. So there are many designs that we are using in qualitative, but they have some characteristics. I'll just focus on the first column, that is emergent. Say a qualitative research should have a characteristic of emergent. That means what? You are having a flexibility, adaptability, and changes to reflect realities and viewpoints which may not be known to the outset. That is emergent, something new is coming. Holistic, it considers the whole, not part by part, as a whole. Intensively involved researcher. The researcher has to be very focused. He cannot do 2-3 things at a time. Full attention should be. If I'm interviewing a patient to know how he is feeling in the hospital, my full attention should be there. Because patient may be telling something, I am doing something else, I will miss the half the information, what the patient is telling. So you need to have an intensively involved researcher. Then the last is merging the data collection strategies. There is not one method of collecting the data. Like for example, if you are having a questionnaires or interview schedule, we use one method to get the information from the subjects. But here it is not one method. You may have to use multiple methods so that we get the correct information. So this is some of the main characteristics that we see in the designs. So what are the common qualitative research designs? Many of you may be knowing some of the names. Action research, which is most commonly used in education field. The case studies, which the students may be using, and even as a method of data collection, case studies are used. And descriptive methods where the content analysis is done. The content, what is collected from the subjects, they are analyzed in detail. Like for example, what is the nursing role in the end of life decisions? So you describe what is the role, 1, 2, 3, 4, after you get the information. Then disclosure analysis. So this is again another in-depth analysis method where we are using how the things are going about. Then you have ethnographies, where you are studying anthropological things, about how it is in a particular community or a particular group or a culture-based things. Ethnology, usually commonly used in a psychology field, which they are using, where what is the thing that they need to understand with relation to the psychological environment, which causes the incivility in nursing. This is one of the examples that by using ethnology. Grounded theory is another common research design used in qualitative. And for example, if you see how does the basic social process of role transition happen within the context of advanced practice nursing transition. That means you want to see how it is changing. Your base is the grounded theory approach. So I'm not going into detail how it is done. Just I'm exposing you to the names, that's all. Historical research, you know something about the past. What has happened, we are studying that. Then narrative inquiry. Narrative inquiry is also considered one of the method of data collection. It is also one of the design of qualitative research. For example, how does one live with the diagnosis of scleroderma? So how do you live? So it's a narrative, how the patient says, how he feels. Phenomenological studies, this is a lived experience. The classical qualitative studies, which many of the researchers undertake, is phenomenological, the lived experiences. So when you come to the design, what are the things that you are mainly focusing on? A study is design, which is a foundation. If you have a strong design, the study can be conducted in a very scientific manner. So how the researcher analyzes also will be planned at that time itself. So a common mistake in qualitative submission is that the coding approach is either not described or does not match the study design. Maybe in the further slides we can see that what is that. And two other core concepts which are confused by the researchers are the themes and categories. Are they same? Are they different or not? So what is a category? Where the codes are grouped together in a single title. That is called as the category. Whereas themes, they are less transferable. You are deriving the themes after you make the codes and the categories. That is what is themes and categories. Sampling. I think this terminology everybody is aware. Sampling methods. But what method of sampling is used in qualitative studies? It depends upon the type of the qualitative design, as we have seen just before. What design is being selected? Usually, it is a non-random method. That means anybody who is easily available with the characteristic, you select them to be part of the sample. And qualitative research sampling is concerned with accurately representing and discovering meaning in experience rather than generalizable. It means who can give you a correct information, accurate information. Such people only you can take a sample. If I give because majority of students are here, if a teacher is asking question in the class, some students never open their mouth at all. Some students, much difficulty, they open their mouth. 2 words they will say, that's all. But there are some students, anytime you ask, they will give correct answers or they will give a complete, whether it may be right or wrong, but they are coming up with answers. So we want such type of subjects in these qualitative studies who can give the responses as the researcher is asking. Researcher is asking one question, respondent is not answering. 2 questions, not answering. Then it is very difficult. So we need to have the sample who can respond to the researcher when they are going on asking the questions. So look for participants or informants who are considered information rich, who can give you. Some people are there who are going on talking. We might have come across such people. So that time, as a researcher, one has to get the information and document whichever is relevant. Something may not be relevant also. The subjects may be telling. Those things you may not document. So whatever is important you take, but information-rich subjects are your sample. And selection of subjects, non-probability sampling methods are the one mostly used. Convenient sampling, which allows the researcher to select participants who are readily accessible and available. You cannot compel or force anybody to be part of the study, who are acceptable and who are available. And purposive sampling avails of accessible participants, but it provides the additional advantage of facilitating the selection of participants whose qualities or experiences are required for the study. So you can decide who can give you the best information. As the study progresses, once you are starting 1 day over 2 days, 3 days, as the study progresses, the researchers look for participants who are posing as challenge, then they modify or enrich understanding of the phenomena of interest. They go on modify. It is not a fixed one. They can change as the study progresses. So a sample size estimate before a qualitative study begins. You will decide how many numbers, but that is not final. The final sample size depends on the study scope. How much you want more. The data quality. If you decide it is 20 people have not given you good information, you need to go 21, 22, 23. The numbers have to go on increasing till you get the accurate, correct information, whatever thing that you are looking, for which the researcher skill is very important. You cannot, the subjects are not giving answer. It depends on the researcher's skill to elicit the information also. That is also one of the main characteristic required by the researcher. And data saturation frequently is a key consideration. Commonly, when you see a qualitative study, they say how much sample till the saturation is reached. Data saturation is reached. But when no new insights or informations are obtained, you say data saturation has occurred. But Thorne, who is a very important person in the qualitative research, he argues that saturation is a concept appropriate for a grounded theory studies, but not other type of studies. So only for that you can use, but other studies you cannot decide. Saturation occurred, I will stop. So she suggests that information power is perhaps more appropriate terminology for qualitative nursing research, sampling and sample size. It is not the word data saturation, but at the same time is She is saying that it is the how much information you have got. So without the right sample to represent the phenomena what you are studying, a qualitative study cannot achieve the data saturation. So the goal, you want to have a good input given to the literature, you need to have a good data. So to achieve data saturation, researchers need to achieve both coding as well as thematic saturation. So what is coding saturation? Which is maybe interchange or mixed with the thematic saturation. So coding saturation occurs when no new codes appear during the analysis process. So you don't have, when you get a new information, you give a code for that. So when there is nothing new coming up, then you say that the coding saturation has occurred. So a novice researcher may mistake the point in the analysis as having achieved the saturation. So it is not that, both are entirely different. So thematic saturation, its ultimate goal of any qualitative study and occurs when no new themes emerge from the data. So after you get the data only, you derive the themes. So sampling, different sampling methodologies that is available. It is convenience or voluntary sampling you can do, purposive sampling, something called as a shadow sampling is also there, because some of the literatures have also mentioned this word, the shadow sampling. And snowball or chain sampling, where through one person we catch another person, another person. So it's like a chain link that is developed. Then theoretical sampling also, theoretical sampling is also another method. So these are any of these methods, one of the methods can be used. Next, coming to the important one of the aspects of qualitative research, it is the rigor that is need to be used. So a qualitative research study needs to have a rigor. How do you say there is a good rigor concept? There are four important features, that is credibility. That means the research done, how credibility is. So when you say there is credibility is there, when there is a prolonged engagement with the data, persistent observation, continuously the researcher is having observation to get the data, triangulation of data across his participants. So triangulation is your collected data, all the things you are putting together, and triangulation of the data across the participants. If you are having 10, 15, across them there is a triangulation is done. Then peer debriefing. So the researcher at the same time, the reader can see how the findings would apply to another context with a similar group. That means now you are studying a patients with MI. In another context, again, similar type of patients. Is the information what you collected from this set, is it similar to the another set? Are they same? So that matching can be done. So that is another thing, transferability. What you are getting in one area, can you transfer to the information to another area and see whether they are same or not? Third is dependability. The researcher has to say, I got this information by doing this method. So whatever information what I am presenting, it is a very accurate, dependable information. That means you can trust this information. There is nothing to doubt because I have used all methods to see that the information is correct and accurate. That is dependability. So for which who will be there? There should be an auditor, not you. You cannot do auditing of your own information, what you collected. Somebody external. So they can do audit and say, oh yes, rightly done. So that is what is dependability. And last is conformability. Strategies of triangulation during the data analysis to minimize the bias. So bias, whenever I am collecting, there can be a bias. So how to overcome the bias is a triangulation. So ensuring the presence of an audit trail of the study implementation. Every stages, the audit, if it is done, you can always say, whatever you do is it, your confirmability can be done. So 4 things: credibility, transferability, dependability, and confirmability. Can I have some help here? Slide is not moving. Yes. So what is the research process that we are undergoing in the qualitative research? One is, first you select the topic and the problems. Then you justify the significance as to why you are doing the study. Then you decide the design of the study. Then you see how you are going to identify the subjects, that is sampling. Then you select the subjects and collect the data, and then you interpret the results. So when you see the phases of this qualitative research also, the main goal is to access the participants' world and meanings. So what is the participant world say about the particular thing? That is what you are trying to find out. So that is the main concept about a qualitative thing that you are doing. And who is the instrument? The researcher is the instrument. So if the instrument is not good enough, you cannot get good data. So if the researcher is not having enough strategies to get the good information from the subjects, then information may not be adequate to make the interpretation. So that is what is the main thing about the qualitative research. You need to see that participants should be strong, researcher also need to be strong, so that both can give the good information about the concept being studied. And what are the main characteristics of the researcher and participant relation, which is very important. So participants need to be treated as colleagues rather than subjects. Otherwise, they will not be opening up. The researcher must have the support and confidence of the participants. Because without participants, you cannot proceed. Any research, it is like that. But here, it is something more. Because they need to open up, come up with more and more information. And maintaining the relationships. It cannot break anywhere. Even if the researcher gets annoyed with the subjects, the researcher need to have extreme patience so that they can continue the data collection process. So what are the data collection techniques that is commonly used? The focus group methods is one of the main thing, where you are having the persons with the typical characteristics and getting information from them. Then you have the IDH, that is where you are having the individual, you are defining the subjects, their interest you are having. Then you have the case studies methods. Case study methods, I think one of us are familiar with. Then grounded theory approach is a design also, at the same it's a method also of collecting the information. Then action research, then ethnographical studies, then observations and group interviews. So these are some of the data collection techniques. Then you have other techniques like artifacts, which are mainly used in historical research, trace evidences, textual analysis, whatever the statement text forms, that analysis is done. Behavioral observations are done. Debriefing, whatever somebody says, again you need to say again that debriefing is done, so that whether it is the same or not. And observation is one of the main aspects. That means when you say observations, it is not only the verbal, non-verbal behaviors also need to be observed. So what is going on here? One need to look and listen carefully. Note routine activities, what is going around. Focus on the details of everything. And note process as well as the discrete events, which may not be directly visible. And note the unexpected events also, which we might not have planned. That also need to be observed. So that is very important. And interviewing, usually it is an open-ended format. Closed-ended is not usually used in qualitative, open-ended. Researcher will define the focus. There is no fixed sequence of questions. What should ask first? What should ask second? As per the situation, you may have a plan, but as per the situation, it can be modified. And questions tend to change as the researcher gains insight from the previous interviews. So respondents are encouraged to raise issues not addressed by the researcher. So they are supposed to raise the issues. And common thing is unstructured, semi-structured, and structured. Structured are very rarely used. It is only in the beginning stage. Then mostly go for the semi and unstructured method of interviews. So main thing that is you need to see that developing a dialogue. Good dialogue should be there with the subjects. Then interviews creativity. You need to be, somebody is not opening up. You need to be creative to get the information. The skill, how well you are able to probe. Probing is one of the important things to get more information. It is not you are making the subject to tell what you want to tell, but you want the information from the subject's perspective. So just a probing, the skill of the interviewer and probing for answers. So these are important things when you're doing an unstructured interviews. There are 4 basic steps while doing the analysis. Once you collected the data, one is raw data management, or you call it as data cleaning, data reduction, that is chunking and coding, data interpretation, and data representation. So one by one, when you see that, you can see one of the pictures suggests that here, once you have the raw data, that is information, you have to organize that, read through it 2 or 3 times, then make notes. Then at the same time, you interpret it, you make the themes and themes of the attitudes or behavior. So these are the overall way how you will go for the interpretation after your an analysis. In the data reduction, what you will do is get a sense of the data holistically, read several times, that is called as immersion, classify and categorize repeatedly. It's not enough once you categorize, again maybe you might have made some error, you can recategorize again and again till you are satisfied. Write notes in the margins, that is called memoing. The side you can make a note of things. Then preliminary classification schemes will emerge and categorize raw data into groups. That's how you make the bulk data which you get from the subjects, you reduce the quantity of data that you have collected. Then the process of reducing data from chunks into clusters and codes. It is not enough just to leave there. You have to make further, you have to reduce it. How do you do that? Chunks of data that are similar to begin lead to initial cluster, whichever looking similar, you make it put together and made a code. Then codes, you are refining, developing code books, labeling the codes, creating codes to 2 to 3 cycles. Once it is not enough, again you need to remake it. Then only you get it corrected. Then clusters, assigning chunks of similarly labeled data into clusters and giving them the preliminary codes. So usually when you make a code, you may have 30 categories to start with. Then reduce the code once, probably twice. So reduce again and refine. So the 30 you may come up to 10. So it is a continuous process that how you will reduce the bulk data into the coding data so that you can shrink the data. Then third step is data interpretation and developing themes. So where you are having the chunks of which are having similar meanings putting together, and then you make them the themes, then creating meanings for those clusters with the labels, and from all these clusters, everything, you are getting the themes, which is what is the end that you are looking for. And then you interpret the themes to answer your research questions which you had in the beginning. Last step is the data representation. So interpretation or analysis of qualitative data simultaneously occurs. It is not I finish interpretation, analysis, then last I know. It is a simultaneous ongoing process. Our researchers will interpret the data as they read and reread the data, categorize the codes and data, and inductively develop a thematic analysis. And the themes become the story or the narrative. So this is how you do the interpretations. So there are different types of interpretation that one can make: storytelling or narrative, chronological order you can arrange, flashback way you can put up things, critical incidents way you can assemble the data, in a theatrical way, thematic way, visual representation, figures and tables. So many methods are there. Whichever is apt method, the researcher can adopt it. And you have computer software also available for analysis. Some of the things names I have just put here, there are some more emerging now. So it may not be tedious as manually, which was being done few years back. Now many are going in for computer software for the analysis also. And we want to apply these findings to the clinical practice. Just a few examples that to say here, how you can use that in the clinical practices. Here an example. Many patients with end-stage heart failure or chronic obstructive pulmonary disease die in hospitals during an acute event without expressing their choices or preparing for the end of life. Usually we come across this scenario. So for which a study, they undertook a qualitative study. They undertook they conducted 40 interviews among the 20 participants who had the heart failure and COPD, and they were treated. At the same time, what they have found out, they identified severe shortness of breath as an engulfing everything in life. We all know shortness of breath is a common clinical feature, but that as an engulfing everything in life, that is what the experience the patient says. So, and limiting their daily activities, they are not able to do any of their regular daily activities. Yet, they didn't associate this with being near the end of their lives. They said there is still life. So, we think in different way, patients thinks in different way. So, once the qualitative study was done, this was the final findings that they were able to interpret. So, there is another example where the policies and protocols are developed based on qualitative research. Like with regard to the interviews, which was conducted and audio taped with the 12 parents or other home caregivers who revealed with regard to the acute lymphoblastic leukemia children. They said that they couldn't absorb all the information that were given. They appreciated getting information and education from the same nurse, believing continuity will help the child. They valued the frequent conversation with the healthcare providers, and at the same time found the written information they received used too much medical terminology. So when you hear this from the subject's perspective, you can understand what protocols the hospitals need to make a change. So that is another way you can apply the finding that you got from the qualitative research. So you have different things that you can get from it. One is, it is about the human experiences by the readers you can get. It can lead to clinical insight or empathy. Once you do a qualitative research, you can find out. Then they will find assessment of patient status or progress you can learn. You can have the anticipatory guidance based on the qualitative research findings. You can also learn something about coaching. That means what we need to do for the patient. So many outputs are coming across after completing the qualitative studies. Because in the beginning, there is a lot of resistance to do a qualitative study by the learned experts. Because what is it going to give? Quantitative, you are able to generalize. Here it is not so. It is not acceptable. It's not a scientific method. But now we see that there is a lot of acceptance of conducting a qualitative and encouragement also. So you have the strengths of this qualitative research. So in detail and in-depth analysis and getting the data. That's the main thing. You may get the data from me, few samples or few cases, but at the same time, you are getting an in-depth data. That is the main strength of a qualitative research. When it comes to the limitation, already we told researcher is the main skill person. He or she should be a skillful person because they are the tool. If they are weak, the qualitative research becomes weak. So at the same time, you cannot generalize to a larger set, yes, and there should be a rigor and the researchers present during the data gathering. It is very, very necessary. So which may be a limitation for many. I need to be present for a long time to get the data. So, but it is a limitation, but with the advantages also. So I just have a few questions. If anybody can answer. Anybody would like to give the answer? A, B, C, D. Which is the answer? C. Everybody say C. Yes, let us check. C is the answer. So I think I can pat my back. I am able to do something, or you are already having information, so I didn't add anything new. It can be either of the way. What is the answer for this? A, B, C, D? A. No other. That side, no, nothing is coming. No B, C, D. A? Oh, you are going with this. Fine. Yes? Please give a big applause to yourself. So thank you for your patient hearing and an opportunity to be here among you all. So any questions, you can just ask. Okay, there is no questions. So everything is clear, or you are just still wandering around where we are? Yes, I think once you start doing a qualitative study, then definitely you will understand much more than listening. So all the best to everybody. Thank you.
Really, you made qualitative research in nutshell. I now request Dr. Meena, Matt, to bestow a moment to Dr. Anisa Matas. Expectation is the key to success. Next session is on the guidance of the scientists from India and history. It is a privilege to have Dr. Meena, Professor of History, Department of Scientific Research, Christian Medical College, London. She has completed her graduate master in 1986 from the Mass University and pursued her master's degree in 1993 from the Convent of the Indian Medical University and doctorate from the University of Hyderabad at Northern Canada in 2012. Ma'am has undergone special training in quantitative research in Canada in 2009 and a short course in systemic review from the University of Nottingham, UK in 2013. She has overseas experience and is a research guide for PhD students enrolled in privacy consulting. Currently, she is a PhD research screening committee member. To add on, she has bestowed with the Integrated Method for Outstanding Performance in PhD Nursing, Clinical Base Nursing in 2012, University of Alabama, Ruth P. Edgar Scholarship Award for being the outstanding student in graduate program in the Faculty of Nursing 2012 and the Graduate Studentship Research Award 2012. Kindly take over the session now.
Good morning. Good morning, and thank you for being patient with my fidgetiness and walking up and down. See, that's a characteristic of nurse scientists, you know. You want to identify the problem and you want to fix it, try to help. So that's what we're going to see. As first of all, I'd like to thank the organizers, the Principal College of Nursing, Dr. Sudha, and organizing secretary and all the faculty who are arranging this conference for giving me this opportunity to talk on this topic. I must say I have not talked on this topic before, and it was a challenge to prepare for this session. And as I see many young faces, it's going to be all the more challenging to get the message across and to make you understand what is important when we're thinking of nurse as a scientist. So I just would like to, I have some points, and I hope we will get something out of this session. At least 2 or 3 points you should learn at the end of this session. And the learning is going to be mutual. I'm also going to learn as I talk about the nurse scientist. So who is a nurse scientist? Probably I'll ask you, and probably you can take 2 minutes, just talk to each other, to the nearby person as pairs, and then take 2 minutes and say to each other who a nurse scientist is and how she's different. Can you just pair up, talk to each other? Yes. And then I'm going to ask what you said. Yeah, just turn and What do you understand by the term nurse scientist? There are some actively talking, but I don't know whether you're talking about nurse scientist or something else. Two minutes over? Oh, okay. So can somebody get up and say what you talk to each other? 1 minute for someone to get up and say what you think about nurse scientist. If you didn't even talk, it's okay. But what do you think? What is your idea about nurse scientist? Okay, very good. That's a very good um, basic, very core principle of a nurse scientist, that she is first giving patient care and is able to extend into any roles. Is that what you exactly mean? Yeah, that's a very good explanation of who it is. Anybody else from this side?
Finding an innovative way to deliver
Care.
quality care.
Exactly. Thank you. That's also another wonderful explanation. Finding an innovative way of delivering care to your patients. Yes. That side. Who are all sitting there? MSCs, BSCs, fourth years. Yes? MSCs are there? No? Okay, 1.5 more minute. Oh, thank you. Evidence-based nursing practice is, yeah, facilitated by nurse scientist. Yes, good. Okay, we'll just go on. You did give a very good picture of who nurse scientist is, and I thank you for that participation in this particular discussion. So here, this is one of the definition. It is not the definition. Nurse scientists are those who actively research the nature of illness, treatment solutions, and the effects of medical technologies that aim to improve the lives of patients. And by improving patients' life, you are improving the future of healthcare. So here the definition says that nurse scientist is a researcher actually who basically researches on different aspects of patient care and tries to improve the outcomes and thereby aim to affect the healthcare now and in the future. So what is the scope of a nurse scientist? What can a nurse scientist do? What all can happen because of a nurse scientist? With the knowledge of nurse scientist, their knowledge and their hands-on experience, that gives basis for the explanation or the definition we heard from here, from ma'am, that she has to be, the nurse who is also knowing about what care is provided. So with her knowledge or his knowledge and hands-on experience, this nurse or a nurse scientist can theorize, hypothesize, structure studies, collect evidence that leads to better care. So the goal of nursing research is to ultimately attain better care standards for our patients, which can be the standards which can be applied for individual patients and the families of those patients whom we care for. So you have a nurse scientist have the knowledge and also the hands-on experience related to patient care. So she can, from her clinical experience or from his clinical experience, they can theorize or, come to a conclusion of what the problem is, ask questions, and then think what are the ways with which we can solve this problem. How can we examine what is the best intervention so that I can improve patient care? That is what the nurse scientist is always thinking of. And this explanation is given by Dr. Nancy Blake, who belongs to this hospital in Los Angeles. So the scope also, there are a lot of scopes slide. I'm just going to explain one by one. Nurse scientists, through their research, create more efficient and effective healthcare strategies when we look at patient care, as a nurse scientist, we also look at not only best intervention, but also cost effective, time limited intervention, which is advantageous for both the healthcare side as well as the patient side. Both ways is it advantageous. How good it is, how effective and efficient they are. Those are the strategies that you're distilling and trying to identify. There are many interventions that may work, but sometimes the interventions may not be applicable in all situations, or it might be too time consuming or too expensive. So as a nurse scientist, we look at which is the effective and efficient intervention that can improve outcomes, but also look at other things such as cost for the system and for the patient. And nurse scientists, so far, if you look at literature, they have come up with so many contributions in the hospitals in so many ways that the outcomes of patient care has become better. Like, they have been able to look at what are the trends in infection. Nurses have identified as scientists, what is the trend in infection? Okay, one of the senior nurse faculty in one of the ICUs was worried about the infection in the ICUs. And also what she did was, when she looked at infections, she also noticed the infections are a little higher at some points in time. June, July, there are so many infections. That's what triggered her interest. So she did a trend study looking back at infection rates. She just put a trend, a column, a graph, and saw how many infections were there each week, and then looked at the trend. And she looked at certain months, the infection rate was going high, very high. And then other months it was low. So she then looked at, now we have to look at what is it that causes this increase in infection in this ICU at this month, June, July, I don't exactly remember, somewhere around June and somewhere around December. And she looked at all the factors, who are coming in, who are going out, how many patients were there, and all the other factors she collected from the chart and the documents that were in the hospital. And she realized whenever there were an increased number of health professionals, because students are posted from critical care, from respiratory therapy, from nursing, and from, the fellows who are ICU fellows who are doing fellowships, when the number was higher, the infection was more. She also realized whenever new people came into the system, the infection was high. So then they came up with a protocol saying whenever new people come in, even if it is one person, we have to make sure that we teach them infection control protocol, and the competency has to be checked for everyone, whether it's senior most doctor or a junior most student. We have to make sure that. So they identified this and they introduced a protocol, and they are following this protocol, and they are able to keep the infection rate very minimal in the ICU. So that's how the nurse with a scientific mind and a preparation as a scientist will be able to contribute to patient care. That's an example. It's not a big study. It's just observations in your clinical area that you make and the differences that you make for your patient. Nurses can also partner with other scientists in other departments and medical settings to share data so that we can build solutions together for complex issues. Sometimes patient care issues cannot be solved only by nurses. We need the help of other health professionals. Sometimes we need the help of mechanical engineers to help us. Another example that I give one of my classmates who was an MSc student, for her PhD study, what she did was, we don't have this fancy mechanical lifts that can lift a patient from the bed like those which were there in abroad. So all that she wanted to do was to work with the biomedical engineering department to create a very simple, cost-effective lift which can be made with, a nice sheet, a bed sheet, and a pulley and a motor. And she wanted to check whether that lift is cost effective, but also safe in lifting a patient who is paraplegic out of the bed to the bathtub or to the wheelchair. She worked with the biomedical engineering department. She devised along with them. They helped her to develop this lift, and she has done or looking at the intervention on the patient care. Is it possible for us to do that? Yes. Yeah. We just have to be thinking forward. We have to think what best way can I help my patient is what we need to think about. So you can actually co-work with other departments. Then there is something called as big data. Evolving trends such as big data, evidence-based practice, patient self-care. These are terminologies which are coming up. Of course, evidence-based practice terminology is there for many years now. We are now very much aware of it and trying to introduce it, but it's been there for the past 20 or 30 years in some other countries. But big data is something that they are talking about now. So we have this data available with which we can change things. Am I supposed to finish? Okay. How much time I have so that I'm conscious? Okay, sorry. Self-care, patient self-care is another concept. We making sure that the patient are self-reliant in most of their care. That is another concept that is coming. So in these things, nurse scientists can really make use of these advanced concepts and trends in their own practices to revolutionize patient care and impact future care delivery. So big data is something. What is big data? There's so much of data saved in system nowadays. There is electronic recording now, and you have nurses. I think many of you in your hospital, I don't know whether you have these tabs near the bedside. It's all becoming very common, isn't it? All are having tabs. Anything that you measure on a patient is going straight into your tab. Electronically, it's all saved. When you look at 1 month of your unit data, you have so many patients, so many data. That's what is called as big data. There's so much of data available. Now, the nurse can use the big data to research. Easily, trends can be seen by using those data. We can even see blood glucose levels for different patients and what varies, when does it vary, all those things we can do. But also, one more thing that I came across is that the nurse can very much look at confidentiality and ethics of data that is being stored in electronic database. Many times now, we are worried about the data that we are giving to anybody. And it's all there. Anybody can Google your name, your phone number comes, your address comes, everything is known to everyone. That's how it is. So when you're gathering so much of patient data in an electronic base, how can you maintain confidentiality? What is the methods that we can access information if you want from this electronic database? Those are things that can be explored, especially with electronic health records. Then another thing which is becoming very common now, and many nurses are interested in, and nurse scientists are looking at, are mobile health care. Either it is by telephone or by many apps. Now we have PhD nursing students testing many apps to see whether they can follow up patients, or the information that you give, the suggestion that you give is being followed by using an app or an electronic device on their hand or an electronic device in their pockets that they have to carry on every day. These are some of the things that we can do now. That's the scope we have as nurses as far as mobile health care and the wearable devices are concerned. And I remember 10 to 12 years back, my guide, PhD guide in Canada, using an app and texting she called her project texting teams. How do you uh, how do you ensure or how do you encourage teenagers to continue with your heart medications? They have congenital heart diseases and they are on drugs. So how do you encourage them to take drugs, because compliance was very low and because of that they had complication. So one of the interventions she created was an app and texting them on that particular app every day, and doing it in such a way that the message is very attractive for teens. So she did it like that and checked whether that was effective in making sure that they are compliant. So this is another way of looking or using these recent electronic devices on improving healthcare. Then nurse scientists can also have an impact on the universal issue of healthcare access. What it means is, how can somebody access healthcare? How can a patient come to the hospital? How can a patient meet a nurse or a doctor? That can be, what are the problems? That is something very commonly studied. One more thing that is emphasized is not only on the patient side we have to look at, what we need to look at also, how nurses effectively give care. Nurses have to be looked at. The next point says, actually, nurses have to be looked at as an investment for healthcare system rather than an expenditure. The administration should never look at, how do we encourage administration or the institution to look at nursing workforce as an investment rather than an expenditure. More nurses means I have to give more salary. We don't want more nurses. Not that way. How can we change that paradigm? How can we make them say, okay, nurses who are going to give patient care at the bedside are an investment for my hospital? That, how can we change that, is something that nurse scientists are looking at. Studies. What do they study? What is the independent outcome? Anything that we say, what are the independent nursing activities? What are the independent activities? Based on that, what are the outcomes? We have to show. In Canada, they're doing a study. What are independent nursing activities? Because of that, how outcome improves. They want to show to the government saying, these are nursing activities. And because of the nursing activities, the outcome was better. They went out of the hospital sooner, because in Canada, they pay for all the patients. So you show to the government how well or how quickly you sent out the patient because your interventions were better. And that way you reduce the expense for the government. So such studies to say, we are an investment, not an expenditure, also can be done by nurse scientists. And our role. What is our role? What are the different roles that we take up? That also may have to be clarified by nurse scientists who are in leadership positions. And nurse leaders are needed to shape future policies and build more effective strategies. That can happen only if we do science, and if we think of science, and if we do experiments and research. Now, we also have to, as nurse scientists, they bridge the gap between research and practice, theory and research also. We talk about theory practice gap very much. We also have to remember there is a gap between research and practice. Many things you find out. In your MSc study, you do everything and say, my structured teaching program or this video works, but all the studies are nicely shelved. It is never used again. Have you applied it in your practice? No. Have you changed the practice? Maybe 1 or 2 days you changed and then you forgot about it. How do we make sure that what we learned from our research can be elaborated, done again in a bigger population, can be implemented in practice? Is there anybody who can say, after my MSc study, in my ward, I was able to implement it? How many can say? What are the things? Very good. Can you give an example? What was it that you implemented? Yeah, were you able to do something from your studies specifically? Sure. Okay. Okay, thank you. Somebody else also, thank you, ma'am. Somebody else also put up their hand. What did you? You reduce the infection rate. What was the intervention that you brought? What changed it? What did you come to know from your study and what did you change to reduce the infection? How did you reduce? What was it that you introduced from your study? I understand what you want to say. You're saying from whatever interventions you are studying, you can bring that and apply it and reduce infection. That's fine. I want to know whether anybody really changed practice. I didn't. My MSc study was useless. I didn't do it properly. I didn't implement it. But I didn't implement it, but I'm sharing. It was about ragi porridge improving milk production, but I don't know whether it really did. But at least my mother said their breast milk thing is better. So I'm going on informing everybody now. Please drink ragi porridge. Please drink ragi. Everybody, I'm telling. That's all I can. But there are some. There are some nursing studies. Like one of my colleagues did a study on. When she studied 20 years back, we didn't have a proper post-op checklist at that particular time. We just randomly was doing. So this thing was to develop a post-operative checklist, which showed that they were able to identify complications early. So she did the study and that checklist became the post-operative checklist for CMC Vellore. We still use it with little bit of modifications. So anytime I read her CV, it's so nice to see, I did my study and based on that, in my hospital, they introduced this checklist. So that is bridging research and practice. How do you bridge it? And sometimes you're not researching, but at least you must try and bring research. It's been done, ma'am. They have done this. Why don't we apply it and see? That is something that a nurse scientist can do. And nurse scientists can also be knowledge brokers. What do knowledge brokers do? Like any broker, what do? They make sure they sell their product, isn't it? Any broker makes sure that something is sold, something is taken, they make sure they are the middle person. So nurse scientists are like the middle person. They have this knowledge and they have the society and patients and families. The knowledge has to come to be used by people. It might be the community, the families, or it might be even doctors. They may not know what we have done and what knowledge we have. We may have to inform them. Or it might be stakeholders or administration because they need to know what we have done. So nurse scientists often bring that. They are brokers in bringing what we have done and know to those people who can use it. See, I did it. It brings the cost down for the administration. See, this is the knowledge that my colleague has done. Why don't we use it and see whether it is effective? We can even do another study, see how effective it is for a general or larger population. That's what knowledge brokers do. Again, an example from my PhD days. I remember my supervisor, after her study, what she did was she didn't keep quiet. She had a meeting. She had a general public meeting to share her findings. Who all were there? It was about HLHS. It's a congenital heart disease which is very lethal, hypoplastic left heart syndrome. Those were the population. So she had these parents of children who have died and who are living in the audience. And she had all the cardiologists and cardiothoracic surgeons on one side and many researchers, scientists, nurse scientists on the other side, and some general public, teachers from schools where these children may go to school and other interested people. All of them were there. And then I did a study. And this is what my findings are. And these are things that we need to change. This is what the parents feel, their difficulties they have, and we have to address it like this. She explained it. And what was profound was the parents' reaction. They got up and said, "Thank you, Gwen, for exactly bringing out our problems and putting it forth to everybody to know." Nobody really asked us. She did a qualitative grounded theory study and she brought it. And the doctors got up and said, "Gwen, we never thought parents are undergoing such problems. We have to find some interventions and we have to provide not only interventions for the child who's struggling, but also interventions for the parents who are struggling like any healthcare professional at home because they are taking care of the children." So that's what I would call knowledge brokerage that she did. So this is an impact model that I found when I was preparing, and it really resonated with me. This is an article which is written by Richard, Leveraging the Nurse Scientist Role Through Entrepreneurial Innovations. It was from Nursing Management, the article. So it says, what do we do as nurse scientist impact model it's called. And it says you do research, you find the evidence when you do research, and the evidence helps in formulating standards and protocols for your clinical practice, which influences the practice, improves the practice, and also improves. There's a lot of things that other things improve, quality improvement, professional development, nurses' professional development that also feeds into this, into the evidence and standards, the quality improvement and the national nurses professional development. All this together improves practice. And the outer circle, if you say see that, it's called as implementation science. When you think of bringing knowledge to practice, I think you know this term. There's so much emphasis given now on implementation research or implementation science. Implementation research and science is what is getting funded. We wrote a proposal and we wrote it with the endocrine doctor and we wrote it as a descriptive study. And he said, "Vinita, you will not get any funding because you're not writing any intervention. Already so much we know about diabetes. You cannot find anything new. You have to see how you can bring the evidence into practice." So we looked at implementation science and we had to look at implementation science interventions. How do you have evidence? How do you make sure you can change the practice? That is different. And that's what people are talking about. And nurse scientists are the key person to develop this implementation efforts and bring change in practice, nurses' practice of patients related to their healthcare. So this is what the nurse impact model talks about. And I will just go on. So the role of nurse scientist is not only to conduct research. That's another thing that we have to remember. It's not only to conduct research, but also provide indirect and direct support for those who are doing research or those who are interested in implementing something. So you, as nurse scientists, we have to support others. And they may provide guidance, direction, and leadership in all aspects of evidence-based practice. So maybe I'll go to this slide, because according to the Cincinnati Children's Hospital, they have given the role of a nurse scientist, and that really was so meaningful, so I put it down. So if you are a nurse scientist, what do? You have to have a program of research of your own program of research. What does that mean? When I entered into PhD program in Canada, the first question my guide asked us, so what is it that you're going to develop as a research program when you finish your PhD? And I'm like, research program, what does that mean, research? I didn't even know what was that program of research. But what she meant was, you're doing PhD, you're going to become a nurse scientist. At the end of it, how are you going to contribute to your profession? Through what research? Do you have a interest area? So you at least should have an interest area in which you will do most of your research, most of your nursing care, most of your teaching. That's what it means. Not only research, your teaching, academic role, and also your leadership role you have to provide in that. So that is what this program of research means. And you have to collaborate with healthcare facility, mentor others in research, provide expertise in research designing protocol, and design and execute any lab experiments, apply scientific protocols. There are many nurses who work with doctors in the lab. Have you heard of clinical lab nurses? Where they do basic research. They look at pancreatic cells and look at how it develops and how it differs in children and in rats and in animal models. How is it? I was so fascinated to listen to a nurse scientist who talked about that by basic research, and the research, based on her research, the differences she made. So you can do lab experiment, you can develop protocols, you can evaluate innovative techniques, you can draft and write scientific reports, submit grants, so you can get grants or money for your research and money for your training, and train and supervise. These are some of the roles of a nurse scientist. What I want to emphasize here at the end of my presentation is, there are few slides on this. What is the qualification for a nurse scientist? Can anybody be a nurse scientist? What do you feel? Here I have put PhD in nursing, but what do you think? Anybody who's interested in asking question, and I say this point all the time to my students, when you walk in your ward, walk by your patient, you look at the patient with wonder. You always have a wonder question. You have to wonder, oh, I'm a pediatric nurse, so I'm always talking about child. So this child is smiling today. Ma'am, this child is smiling very much. It's really, I'm looking at it and very different, ma'am, from yesterday. If the student comes and tells me, I'm really happy, because that's a great observation. She's wondering why the child is smiling today, not yesterday. Or the child was smiling yesterday, and today, ma'am, the child is all the time crying. I don't know why. Or the MSc nurse the other day ran and came and said, ma'am, this child is looking very lethargic today. I'm going to go and check on blood sugar level and see whether the sugars are down. You always wonder why the child is there, why this patient is different. What is it? If you are a nurse who are asking wonder questions, you are a scientist. Okay, so make sure whether you're a BSc or whatever level you are, make sure you ask wonder questions, because that makes a lot of difference for our patients. For our students, you ask the same wonder question, faculty. Why is the student doing well? Why is the student not doing well? What can I do to improve the learning situation? You ask such wonder question, you become a nurse scientist in academia. And whether in academia or in clinical area, when you ask these wonder questions, you become a leader automatically. So the leadership comes in automatically into that. So that's the qualification basically to be a nurse scientist. Of course, because all nurses don't have time to do research, we do have specially prepared nurses who do the PhD, and it's different from something that is coming up now, the doctorate in nursing practice. The doctorate in nursing practice does not concentrate on research aspects. It concentrates more on clinical care aspects. They do look at evidence-based practice, evidences that can be implemented, yes, but the PhD prepared nurses are the ones who are supposed to improve nursing science. So what is expected from any PhD scholar? You are the future scientist who are going to improve nursing knowledge. You're going to add nursing knowledge. You're going to add to nursing science. That is what is expected. And many times we don't do it. We fail to do after we finish our PhD. So this is, I got this when I was looking for reasons nurses do PhD in India. And this came up, this slide. Is this right? Is it why we are doing? Jobs in top hospitals if you do PhD, or high salary, or huge demand. And in another slide, you want to get a degree. And one of the review paper, which was done by Dr. Suresh Sharma, he has published a nice paper. I think this is the only paper on PhD nursing in India. He has said the most common reason nurses say that they want to do PhD is that they get a doctoral degree. You don't want to be known as nurse, but if you have a doctor near it, it's very prestigious. Is that why we are doing? That's a very, very wrong reason. We have to improve ourselves. Definitely, educationally, we have to improve, but we don't stop with getting a degree. We have to go beyond that. And some of these were is this right? I'm asking myself. And maybe I should not even show it to you because it doesn't look right. Only PhDs who are working here, I don't know. And very less information is available about what PhD nurses in India are doing. How we are contributing? Nil. So all the PhDs, please make sure we plan a study and do or a review and publish data related to what we are doing. That is important. So these are some of the coursework that INC has put forward for PhDs, and many universities do not have this coursework. Only focuses research. You start with the research topic. You start with a research title. You do a research, close it, and walk off. That's all. Finished PhD. And what type of studies we are doing in PhD? Sometimes very, very not related, not really important to you, not topics that you are passionate about. Very few are doing. What is comfortable? What is, flexible? What is accessible? That's what is the topics that we are selecting. Not what you are passionate about, what is needed in the clinical area, what is needed in the academia. We don't do that. What we need to do is what way can I bridge the gap in nursing knowledge? What is the gap in any question or area, problem area, and how can I bridge that gap? How can my PhD findings bridge that gap? What points in my PhD findings bridged my gap? All the PhDs, did we all write what science gap, nursing science gap, our findings filled? Did you write it in your report? PhDs? All those who finished, that's one important thing. This is the gap that was existing. We start with that gap in our study and we say, my findings fill this gap. This is still existing. I don't know. We need to do further study. That's what we have to do. And that is the gap we need to continue as program of research. I attended one of the PhD Viva. She finished her study 2 years back and her study was in an old age home. She was passionate about older people's this thing. Then she came for Viva and I asked the question as an examiner. So in this 2 years, you found this, what did you do? I was not at all here. I never went there. I was working in this hospital and this college, and then I went to college. Now I'm going abroad, she said. If you're not able to contribute to what you did based on what you did, there is no relevance for our PhD study. And not only research, we as PhD scholars and PhD finished faculty, we should be thorough about our nursing science. So that's why we need to know about current health issues and policies, what leadership means, what does informatics and big data mean, what is philosophy, what is your philosophy? If I can say, in your research, what is the basis of your work philosophy? Which philosophical ideation do you bring into your research? Can somebody tell? Ma'am mentioned something about positivism and interpretivism. Do you remember from her slides? Anybody? Students? Qualitative research, she talked about positivism Yes, interpretivism. Those are all philosophical underpinnings. Are you a positivist or are you an interpretivist? Where can you place yourself? Or a critical realist? Where are you placing yourself? On what philosophy is your research based on? You have to be clear about it. If you're not clear, then we have to go back and read and understand. And, I can say in this question, my philosophical approach is what I'm going to take, because this question can be answered only by this approach. So I'm going to go into that. But I am an interpretivist, basically. I love qualitative research. That's my philosophical underpinning, basically. But I'm not going to say all the questions can be answered by interpretivist philosophy. So those ideas also we should know as PhD. And theory building, applying conceptual frameworks, all that we need to be thorough about. And we need to be knowledgeable about research. So when I applied for PhD, I was always looking at my research topic. And the person who interviewed me in Canada in 2 colleges, they said, Vinita, research is only one small part. Last, there is so much of scholarship involved. And I said, oh, what is scholarship? What do they mean? I didn't know at that time what they meant. What scholarship? I said, I have experience, I can do. No. PhD is not only doing research. I know your guide will help you with research, but there's so much other coursework that you need to do. You have to do well. In one college, because I was from India, they thought I'll not be able to do PhD in Canada, because they had a very high expectation of this thing, PhD scholars. So they said, I don't think you'll be able to manage. That's what the PhD person said. In the other college, they were very open. They wanted to encourage study. And I did well. I was able to show that we as Indian nurses can do very well in a PhD program. So if I can do, you all can do. All of you are thinking of PhD, can do. Anywhere we can shine. But make sure that we are holistically prepared as scholars and nurse scientists in research, in leadership, and in education. That is what is needed. I'm not going by the slide. I'm just telling my ideas. So if you are good in these 3 areas, you will be a scientist who will contribute to the healthcare. You will be able to contribute in the clinical area as well as in the student care area. And I thought after PhD, it's not really important to go to clinical area, but you can't do research without keeping in touch with your patients, keeping in touch with your students. Only if we give care, I go and I talk and I ask my students, ask my staff about what is happening to this patient, to our patients, I can think of relevant clinical questions to improve patient care. So patient care, academia, and research are a combination. You can't, as a nurse scientist, you can't separate it. That's the most important thing. And total number of PhDs in India, according to INC 2021, is 153 finished, and 365 are on roll. We have no idea about the number of PhDs who are finished in all other universities. We don't have a number. I tried. I don't know whether anybody has a number. In India, how many nurses are PhD holders? We don't have. And it's sad. We need to make sure that we have a repository where we can register and say, I am a PhD, I'm finished. So we have a record of who are all there as PhDs and what our contributions are for nursing is something that we need to think of. So these are some of the key factors, I can't see, for education, is it? Let's see the topic. Oh, key factors for poor quality of doctoral education. What are the poor quality doctoral education? One is insufficient qualified competent faculty, lack of infrastructure, lack of funding, performance of preference for part-time PhD. That again, this is from the article that Sharma sir has written. These are the Reasons for poor quality PhD. One, everybody wants to do part-time PhD. Part-time PhD will not work according to me. Or otherwise, you have to take leave during your data collection and your write-up. If you're not taking leave and doing data collection, that's not real data collection. Full stop. You can't concentrate on good data collection if you're working and doing this thing. I don't know how it is possible. It is not possible. So I tell my PhD students in my own faculty group in pediatrics, now itself I tell, this is the time, 6 months you take off, then do data collection. So these are some of the common reasons. So we have to get over these hindrances and make sure that we are well prepared as PhD scholars and can contribute well to research. So I would like to, I'm finishing. I would like to finish. I don't want to look at all the slides. So with that, I would like to finish my talk on who a nurse scientist is and how can we as nurse scientists contribute to academia and healthcare. There's so much scope and it's up to us to take that role and take the opportunity and do well. Thank you.
I request Dr. Basil to resume Dr. Vinita.
Good morning to all of you, and glad to see all of you in an offline session. And I think we are having both an online and an offline session after a very long time. So it's different for us after 2.5 years to be in an auditorium and be comfortably seated and see the person who is talking to us, where we will put off. Sometimes our camera is off, sometimes the person who's speaking's camera is off, and either what they talk goes above our head or goes in the wind, right? So I should take this opportunity to thank the organizers. Organizing an offline program is not an easy task. At the end of the day, I should ask Leena ma'am about it, and she should, and her committee will tell me that. Okay, so I thank the organizers for having given me an opportunity to come and speak here. I thank the principal ma'am and the organizers of the quality team. I think that is the initiative. This initiative is a part of your quality initiative, and that is why I choose this topic. I know I am trying to tie knots, right? But knots are important. They tell us where we are going. And I'd like to give a little about the theme, Innovative Valley in Research, the Power of Nursing Science. There you have something called recapitulate, relate, and reflect. All our life we do this. We do something, we recapitulate, we relate, and we reflect. I think working towards quality, each member of the quality team will be able to do this, will be able to understand this, how to recapitulate, how to relate what and what. We try to relate everything and reflect where we are. So that is one of the basis of the program today. So with that brief introduction, I would like to go in for my topic, which is accreditation and research in nursing. Why do we need accreditation? When we join an institution of higher education, we are always interested to know whether the institution is accredited or not. Is it Indian Nursing accredited by a statutory body? Whether it is accredited by Indian Nursing Council? Do we have a recognition by the Tamil Nadu Nurses and Midwifery Council? Is my graduation degree valid? Okay. So we look at how valid is my degree. Why do we want to know whether our degree is valid or not? They will take us for a job only based on your validity. Where have you studied? It's the first question they ask us when we go for an interview. So accreditation in healthcare is something that has become mandatory. Okay, this is for those who are going to be graduates. Work in an accredited institution where you have all the protocols, everything in a systematic way. You are likely to have, I'm not marketing any organization for that matter. I'm just speaking about it, why an accreditation helps you, because it helps in employability and maintaining international standards. Okay, as nursing, as we join nursing, what is our aim? To get a job. Very simple, is to get a job. Second is to get a job anywhere in the international forum, global market. Okay, we want to earn a living. That is the purpose of an education. So you need to be able to migrate and you need to be able to meet the international standards, for which we have a lot of accreditation organizations in different places of the world. Okay, the time now is 11:40. I would preferably finish by 12:05 or 12:10. Okay, so going on for accreditation in healthcare, we have a lot of organizations like Accreditation Association. These are all international organizations. Now going on to accreditation organizations in India, we have NABH. All of you would have heard of this. We may be working in an NABH certified hospital, accredited hospital. Other than that, what do we have? We have QAI, okay? And then National Quality Assurance Standard. Other than this, we also, each organization also works for ISO standards, okay? Getting a certificate from ISO is valid because you are maintaining certain standards or criteria given by the ISO. Okay, so that also enables the credibility of the organization. Why do you need to accredit, and how does research play a role in this? So we have, all organizations have a mission statement. Okay, so this mission statement is not just static. It is dynamic. It changes over time. Okay, it changes with the healthcare demands, with the changes in the community, with the changes in the population and activities. This mission directs the activities. There is a composition, there's a board and history. This is also, some of this is also for the quality team out here. Okay, so there is a process, program and standards. Why do we have all this? We have all this for establishing standards and promoting quality care. That is the main purpose of this any organization. That ultimate aim of it is the mission should lead to the quality care. Okay, should be fine. Okay, now where do we have this NABH guidelines? So when we go into the hospital, we follow certain NABH guidelines. This is healthcare accreditation I am talking about. Okay, and these things do not happen without research. When I am following a protocol or a policy, we follow the guidelines of the organization. For example, you have healthcare infection control. Okay, should be. Yeah. So we have certain guidelines, policies, protocols. See, some policies and protocols may be international standards. How they can be translated to the local? They may be done by that particular healthcare organization, and that in itself is a research. So if you need to be accredited, you are going to standardize your activities, which is a research activity. So for example, management of medication, patient rights education, care of patients, access, assessment and continuity. When we go and do a research of a particular healthcare program, whether it is reaching the community, we are also facilitating research. We are also facilitating data. Okay, every activity of ours is research, but we are not giving it that impetus. Okay, so patient safety and quality indicators, that is nursing quality indicators. We have nursing quality indicators, which is skincare, infection control, prevention of medication errors, identifying the patient correctly, communication to the patient. All these are some of the things we do. Almost all our research are in these areas. If you look at it, we are actually facilitating an accreditation process, and we are actually collecting data. So research and accreditation go hand in hand. They are not two different entities. So whatever data you are collecting should actually facilitate the organizational growth. So it should be used in every forum, but we separate it in different forums, are not ready to take it up. Whatever is done as a researcher, it should be applicable in the healthcare setting and it should be utilized. It is tied. You cannot go one without the other. Continuous quality improvement happens in any organization. We want ourselves to improve, right? We don't want to go back to yesterday. We want to go forward to tomorrow, right? So continuous quality improvement is another initiative. Responsibility of management. The management also has to be responsible for this. So they have employment initiatives. So accreditation also looks at the employment initiative. What further benefit are you giving for your employees? Are they getting any benefit for attending a conference? Are they getting any benefit for publishing a research paper? Are they getting any benefit for doing a research? How much of continuing nursing education? Are they getting a benefit for attending a CNE? Those who are working in organization will understand that these are some things that is also helping the accreditation. It's also facilitating your professional growth and development and the organization's professional growth and development. Human resource management, information management system, like ma'am said, all is data, big data. We have data everywhere. If you want to do retrospective studies, so many studies can be done in PSG. So many studies can be done in different healthcare organizations. You need to just identify what is the study that you need to be doing. Okay, so that is very important. Most of our research are associated with structure, process, and outcome. Structure is we are trying to identify a particular teaching modality or a particular way of implementing a teaching program to patients. Then we want the process. We implement the process and then we see the outcomes. If you take up a healthcare organization, it is basically associated with infrastructure, demographics, technology, education, facilities, all these are the infrastructure facilities. What is the process? Diagnosis, treatment, appropriateness, process of care, resource and requirements, and outcomes. Ma'am has already told, Vinita ma'am has already highlighted this: mortality, morbidity, cost, factors creating the cost, and quality of life. Ultimately, what is the outcome that we want? We want the quality of life of the patients to be better or the community to be better. So you are worried about the structure, process, and outcomes. These are the three things that dictate the process of research as well as accreditation. It can be patient acuity, nursing care needs and activities, complexity of cases, processes, training, and nursing education. For example, I want to teach a group of nurses a particular activity, a particular protocol. That becomes a research. This research enables accreditation. Okay, outcomes, nurses' satisfaction towards workload and standards of care, whether they are able to balance the workload, all these are important. What are the benchmarks or the performance indicators for a healthcare organization? The mortality rates, readmission to the hospital, length of stay within the hospital, how efficient are you in following a protocol? You have a standard time. When a patient gets admitted to the ER, the patient should move from the ER to the next area of care within a particular period of time. Are we following that? And if we are following that, we are higher on the level of accreditation. That is the only thing. Are we following it? Why we are following it? Why we are not following it? It's an audit. It can be a research. If we are doing it as a research, first we will do a needs assessment. Why it is not happening? Then we'll try to implement measures to make it happen properly. That's research. And once it's happening, it helps in betterment of the outcomes. Reduction of post-operative complications, reducing patient wait times, outcomes. Outcomes are mainly patient satisfaction. It could be a clinical outcome or a patient outcome. The clinical outcome will be your mortality, morbidity, cost factors, all these come under the clinical outcomes. The patient outcomes will be patient satisfaction with the care. And the visibility of the organization. Who carries the information about the organization? Those who receive the care. Our consumers are the care receivers. So they give the information. These are metrics. Metrics are measures. Okay, rates. How efficient is your number of patients coming into your hospital? Whom do you compare yourself with? Whom would you compare yourself with? You would compare yourself with Abdul Kalam? You will compare yourself with your own batchmates, right? So that is the peer group comparison. A hospital that is 1,000 bedded should be ideally compared with another 1,000 bedded hospital. A rural hospital should be compared with a rural hospital. You cannot compare a rural hospital with a urban setting, because all the levels of care or components are different. How can accreditation and research be brought together? Patient satisfaction, that is commitment to quality and clinical outcomes, community acceptance. How accreditation helps? When you work in an accredited hospital, you have credentialed staff. You are recognized, you should have a recognition, and then you work. And it helps in continuing education. How many hours of continuing nursing education you attended this year? It will be asked. Okay, if you are working in a healthcare organization, it will be asked in your academic performance indicator. How many hours of continuing nursing education within the organization you attended? How many workshops you attended outside your organization? Okay, they will not just ask how many hours you attended. You went for the CNE. What did this organization benefit out of you going for that CNE? Okay, so that is a clinical outcome that I am looking for. When you go for a CNE program, I want the outcome of that in your patient care. If you're going for a workshop on wound care, that something out of that wound care should be there for my patient. It could be assessment, it could be monitoring, it could be reduction of infection, all these. And it could also be teaching that to your co-nurses. You may go for a workshop, teach that to the other nurses. So that will lead to a gain in knowledge. So that is continuing education. International competitive healthcare. See, anything is competitive, right? The global market is competitive. So international recognition is very, very important. Medical tourism. When a person comes from another country and gets treated here, he carries the image of this organization to the other places. So when he or she carries the image of this organization, he may tell the others the cost is less here, the care is good. So go to this organization and take care. Okay, medical insurance. How many people claim the medical insurance, and what is the outcome of that medical insurance? Are they benefiting from that? Especially with government schemes. Those are things that we need to have data about. Areas of research in patient care. We have a lot of areas of research in patient care. It could be outpatient, inpatient, community, patient needs, communication. Communication is an important aspect that is seen in accreditation. This aspect is also, and changes are seen in accredited organizations where the communication is given a lot of importance, and this happens with the flow of research also. Diagnostic and therapeutic measures, time taken, how the patients are getting the information, the results, whether they are being told. Ethics is another component that requires to be taken care of. Clinical outcomes and process measures. Ultimately, patient satisfaction is something that all the accreditation organizations give importance to. For us also, when we are in a particular ward, what do we at the end as nurses, what will collect from the patient at the time of discharge? What would you satisfaction? What would you like to tell back? Did you feel the nursing was good? Did you feel the doctors attended to you in time? Did you think that the care given to you was done on time? What things can be improved? What things you did not receive? What things you think you could have received better? All this information we are collecting. That is a research, that is also a process of accreditation. Only thing we are not, publishing it too much. Okay, if we understand that all these are tied together, and education, healthcare, research, everything goes together, and we can only work together, only then all these will be put into effect. Otherwise, our research will stay with the education department rather than in the service department, where it has to be implemented. Even if we go and tell implement, they have a lot of other concerns. Okay, so those things will prevent it. Okay, next we'll go on. This is about healthcare organizations. Next is healthcare education. When you look at this here, I am just bringing the criteria. This is for the faculty members. So you have curriculum, teaching, learning, evaluation, research, innovations and extension, infrastructure, learning, resource, student support and progression, governance, leadership and management, institutional values and best practices. When you go to curriculum, how I am implementing the curriculum? Are there objectives? Are there specific learning outcomes? Are there course outcomes? Are there program outcomes? are there graduate attributes, and is the student who is entering able to meet the market demands? That is what is being evaluated. At the end of it, first year, how many students are joining? Fourth year, are all of them leaving? And at the end of the fourth year, are they all employed? If they are employed, where are they employed? This is all data. It talks about the institution. Okay. And research is a very important component, given a lot of value in international forum. Okay. We still are yet to implement the value of our research into practice. Okay. Statistics are very useful. They frame the indicators, and this leads to criteria and standards which are established, and this will tell us the accreditation of any higher education institution, for which you have organizations like NAC. Okay. Here, what are the things that are going to be seen? Teaching, learning, and the outcome of teaching, learning. Say this semester I am having 100 students. As a teacher, if all the 100 students pass, I should be happy, right? Just pass, I should be happy? No, then how many of them score higher? How many of them are average scorers? How many of them have scored low? What can I do to help these low scorers? Is something that I do as a research. What are the remedial measures implemented by me? Can be a research. How am I implementing remedial measures? The third row is laughing. They are thinking remedial measures or what remedial measures? Okay. And right. So we have teaching, learning, and its outcomes. Fine. So anyway, we will get to remedial measures at some point of time. You will have to meet it. Okay. Innovations in education. Innovation in education. Now, half of them, maybe how many of them are attending? 60 participants are attending this via Zoom session, right? So I am able to reach you as well as reach other participants who are online. So that is an innovation in education. Assessment of learning styles, utilization of the same in education, use of modern teaching learning methods. It could be an online teaching module. How effective are they? That is the baseline. Okay, just teaching can be different. How effective are they in reaching out to the group? There are a lot of courses online, but how effective are they? Are you able to understand? Are you able to apply them into practice? Development of institutional best practices. This could be your simulation. This could be your standardized patients. This could be different techniques that could be applied as an institutional best practice. It could be an online education. Okay, all these are some of the things that are important in innovation in education. Clarity of content, how clear the content is to be reaching the audience. Then rubrics and portfolios. These are used in other countries, and rubrics are used in our country. Okay, not that rubrics are not used. Rubrics are another 75% and above. 60 to 75%, below 60%. This is rubrics, very simple. You categorize them, you have ways to say below 60% is this, below 50% is this, 60 to above 75% is this. Those explanations and classification is called a rubrics. Okay, it's nothing much. It is just how you categorize things in that. Okay, and portfolios. Portfolios are used in other countries. It will not take a long time. It may come into India also. It may be there in some other institutions, which I may not be aware. Okay, I haven't searched for that. But these portfolios help in employment. Okay, when you go for a job interview, the students or graduates are supposed to take their portfolios or submit their portfolios to the organization. Use of technology is online learning, blended learning. Now I am doing it in a blended mode. I am offline as well as online. So you are implementing technology, simulation and scenario creation, virtual learning. Virtual learning is another area where you will be working in future. Virtual learning is already happening, right? People practice surgery in virtual learning. Okay. Evaluation methods. Evaluation methods include strengths, weaknesses, individual differences, learner performance, periodical assessment of the evaluation methods. I may be using a particular evaluation method. I want to know whether that evaluation method is appropriate or not. How can I use it better? Is the blueprint correct? How can I make it better? Okay, those are some things that I need to check. Okay, other than that, all of you would have experienced OSCE. How many years since OSCE? The past 2 years, yes, OSCE was the only way. Before that, OSCE started getting implemented. And did you find it useful? Yes, you found it useful. If you were in the patient care, some questions you would not even have bothered to learn. Here, no other go, you learned some of the things. You knew first step is this, second step is this, third step is this. It's mandatory. If I need to get 10 marks in this, these are the core skills of that particular procedure. These are the other skills. I have to get this much mark, only then I pass. OSCE is a method they use for employment assessment in foreign countries. If you fail in an OSCE, you have to come back and do that OSCE again. You have to read the steps, get that competency, and only then you get employed in organizations. So you have also understood different methods of teaching learning. Then faculty development. Faculty development, as faculty, we cannot say we know everything. I did not know much about online education. So that I had to undergo a course on online education before the Corona situation. Only then I could take classes in a Google Classroom, Google Meet. Okay, how to take attendance in Google Meet. Yes, that was a big task, right? Call 100 students one by one. Then we knew you also have an Excel sheet, compare both, right? So those were all learning for us over the past 2 years. So faculty development program, focused workshops on methods of teaching, question paper setting, blueprint, online evaluation. We also went in for online evaluation, right? We gave you a lot of quizzes in Google Forms. Those happened over the last 2 years, not before that. Before that, I was not sure about how to use a Google form. And then I started becoming an expert in Google form. Right, as faculty, we became, but how did it help? Participatory teaching, learning. You also were involved, I was also involved. So we were able to continuously undergo the learning process. Community services, it could be survey, health education activities, camps and clinics, national health and welfare programs, in-service education, school health program. All these areas we do research. Any community area we do research. This research helps not only data collection, it helps in community services and thereby enables the organization to go for accreditation. If your community area is strong, it is something called as corporate social responsibility. How efficiently you are doing or reaching out to the community. Do you have a rural health and training center? It's an important question. If you have a rural health and training center, how effective is your RHTC? What are the functions of the rural health and training center over the past 1 year? What have you done in all these areas? This is important and it is both a research and an accreditation year. And evaluation and feedback. At the end of each year, your teacher asks you feedback. At the end of one unit, the particular teacher will ask you feedback. Yes, not just oral. Now you are asked feedback online. Am I right? முன்னாடியெல்லாம் ஒருலா நான் ஒழுங்கா எடுத்தனா அப்படின்னு கேட்டுருவோம். ரைட், இப்ப நான் ஒழுங்கா எடுத்தனான்னு நான் கேட்பேன். அது தவிர I also get a written feedback. Now it is more online feedback. Right? You know that you have to fill up in the Google form. Yes, I understood. No, I did not understand. Sometimes the student will be sleeping and they will put no, I did not understand for all the questions. And it becomes the work of the teacher to catch hold of that student. Why did you write that? No, I did not understand. Yes, we do that. Yes or no? Yes, you did not understand. How did you write? I did not understand. Ma'am, I did not understand how to fill up the Google form. Really, that comes, see, I am there, I give the instruction. Still, this happens. Not only ask your teachers, they are laughing because this has happened for each of them. They'll be wondering, there will not be 10 people, there will be 2 people only. Catch hold, and it becomes a task for the teacher. Catch hold of that student. Why that student write, no, I did not understand? Because I took all the pains more than any time before. I have taken pains to take the class. The student is giving me, no, I did not understand. That student, ma'am, I thought that option was score 5. I thought this option was score 1. So I thought I clicked the first button. Okay, please read what Google Forms you are getting and give your evaluation, because they are evaluation of your teacher. Okay, so curriculum evaluation will be from the teachers, students, parents, and employers. We get evaluation from the parents. Your parents are asked at the time of first year joining, at the time of leaving, alumni feedback, employer feedback. Let me tell you, from the PSG College of Nursing must be, when you go and get employed, we'll get employer feedback. Okay, so from any institution, we want our students to shine. We want our students to be competent. You are like a brand ambassador, all right? You are like a brand ambassador, and next time they'll say, your students were very good. We want more students from your college, right? We want that, right? Wherever I am working. Okay, so that is important. So evaluation or feedback from the parents, employers, it's not just you who are giving the feedback, it's also the organization where you're working that gives the feedback. Other ways in which accreditation and research help us: student performance, syllabi and lecture, implementing a new syllabi, implementing a new curriculum, how effective it is. Lectures, how effective is this lecture? It could be a simple one session that could also be effective. How are the support services for the students? What are the other support services available and are they used? How much are we using our library? Very important. How many hours the student is going to the library? Definition, Google. Etiology, Google. Nursing process, Google. Library book with nursing process, sitting and sleeping. Okay, so we want that library is a resource. Okay, at some point, see, very good. You are having a phone, you are having, see, everything is available in the hand, but you are coming to the college 8 to 4 and the library is available in your campus and it requires to be utilized, not for sleeping, but for education. Okay, so like when you finally go at the end of a year, no, even you will look at yourself. How some institutions, like when I pay this fees, I would like to, at least when I studied, when I pay so much fees, I would like to utilize or get to know all the facilities in that institution, and the institution that is how it used to be. Ipo fees katran, let me go to college, let me. No, your parents are paying fees so that you know or utilize the facilities. Library la enna book irukku, nursing process or book irukka, your column irukka, at least go open that book, see that there are a lot of books written by a lot of authors. Please open those books and read those books and encourage your library utilization. That's very, very important. At the end of the year, first year student, did you go to library? One will raise, two will raise. Ma'am, I went, touched the library and I came out. Please don't do that. Okay, that also can happen. So please utilize your library. Research activities and outcomes within the organization. It could be funded research. It could be scholarships, fellowships. When you come to know about any of this, join this, do a research, learn what research is. You can learn that now. It will be ideal for you to learn it and implement it. And community services rendered evidence-based practice. Networking is another important thing for any organization. It could be national networking or it could be international networking. What do we get from the other person? It's not just be giving to the other person. What do we also get from the other organization? Is our student getting any lectures from a foreign university? Are our students able to go there and learn how they teach nursing? Those are also important in networking. Audits are very, very important. It could be an internal audit. It could be an external audit. Documentation, they help in institutional database and they help in decision making. When you do an audit, how many hours has been spent? What is the cost? Why the cost was so much? How can I reduce the cost? Even for example, the first wave of Corona, so much use of the personal protective equipment. How can it be reduced? What was the cost that was accrued? Okay, all those things help in decision making and they are the institutional database. It helps to understand one's strengths and opportunities which are positive, the weakness and challenges which are negative, and the strengths and weaknesses are internal, the opportunities and challenges are external. So we need to be able to, the organization needs to be able to be aware of all this. It was before, it was SWOT analysis. Later, it became SWOT analysis. Okay, so this actually for each of us it is important, and for the organization it is important. I'll just touch down 2 systematic reviews as to why accreditation, research in accreditation. How did accreditation help in organization? The first 2 things, they saw a lot of improvement. How accreditation helped? It led to change, it led to professional development. The other 5, that is profession's attitude, organizational impact, financial impact, cost measures, program assessment, there was not much of a change. Then patient satisfaction was reasonable, and public disclosure. See, when an organization is accredited, they will want to put it in the banner, right? So and so organization accredited with so much grade. It helps to create visibility for the organization. It also helps in complying with the standards, healthcare professional behavior. You are expected to behave like that within that organization, and it leads to better patient outcomes. Staff patient satisfaction, nurse physician, the impact of accreditation was seen in these common aspects. Staff patient satisfaction, nurse physician relationship, nursing quality, reducing turnover and vacancy rate. By this systematic review, one study in this systematic review gave this. But hospital outcomes led to inconsistent results because of the wide variation in the hospital. You cannot compare hospitals. Some hospitals may be 750 bedded, some may be 500 bedded, some may be 1000 bedded, more than 2000 bedded. And in that case, you cannot compare one accredited hospital with another accredited hospital because of the services that may be given. Impact of accreditation on the quality of higher education institutions. It led to academic standardization, improvement in academic training, teaching quality, accredited career, networking, national, international acknowledgement, graduate profile was found to be increased. It led to visibility, recognition, and value. And mobility of students, teachers, and researchers. Negative aspects, definitely it led to workload, and it led to curriculum changes, which led to more of work. Cost was another factor that was involved. Needs to merge with the national, with the local. What is the local requirements along with the national? Standards, there was flexible standards with different areas, and research outputs, again and again, any accrediting organization gives a lot of importance to research outputs. We need to take care of external standards and internal purposes. The students first form the base. Academic interest, then government, professional organization, and employers. These dictate the external standards and the internal purposes which affect the accreditation. Coming to the how I brought accreditation and research together. You have a teaching learning experience which happens within the healthcare system, and this healthcare system may be accredited, and you have research also happening towards accreditation and within accreditation, ultimately leading to better quality. That is the purpose of any organization and any accreditation measures that are being taken. I thank the organizers for having given me an opportunity to talk on accreditation and research, and these are a few of my internet references. Thank you.
I request our principal man from VJ sir to respond to the
A very good afternoon to all of you. Or should I say good night? Not yet. I'm standing in between you and the lunch. So kindly excuse me. I'll try to finish as quickly, and I'll keep it as engaging as possible. How many of you are students here? All of you look like students, but nevertheless, I want to make sure. How many of you are students? Right, excellent. How many of you have undergone some training in ethics? Not many, okay, fine. That makes my job easier. So first of all, I would like to thank ma'am, Dr. Jayasudha, Principal, PSG College of Nursing, Dr. Leena, and her entire team of the Quality Control Committee for inviting me here, to be here with you to talk on ethics. Probably I'm the odd woman out from the medical fraternity. I have a large gathering of nursing fraternity before me. So this is what I would like to talk or say about nursing. Nurses are the heart of the healthcare. So without nurses, the healthcare will not survive or sustain. You don't build a house without its foundation. You don't build a hospital without its nurses. So that is my humble opinion on the nursing fraternity. And I'm really honored and humbled to be here with you to give this talk. So let us just go through a photograph. Many of you have seen her or may have heard about her in the newspapers. Just for the benefit of those who did not. Who is she? Yes, she was a nurse and she was abused and she was in a vegetative state for close to. Yes, very good. So she's Aruna Shanbag, who got sexually abused and also, hurt by a man, which led to her being in a vegetative state. She was in the vegetative state for close to 42 years. It's not easy. What happened then? Her friend, Pinky Virani, who is a journalist, filed an appeal saying that this is not the right way to live. Like, we are torturing her. She's suffering a lot. So let us just, kind of do a passive euthanasia. Like, we can euthanize her. But the court, finally rejected her appeal. But what made me really, kind of impressed is the solidarity that was there between the nursing fraternity. The entire nursing fraternity staged a protest against this plea and said, no, we are not going to kill her. We're not allowing you to kill her. She is like a child. We are taking care of her. What is your problem? Right? This is what they had to say. We have to tend to her just like a small child at home. She only keeps aging like any of us. Does not create any problems for us. We take turns looking after her and we love to care for her. How can anybody think of taking her life? So this is the statement by the chief nurse at KEM Hospital, Mumbai. So this kind of drew my attention. This was why I am narrating this event here, which is related very much to ethics. Any idea? So India in 2018 made a landmark judgment, or they passed a law saying that passive euthanasia can be allowed under certain conditions. It's a big landmark judgment which the court had given in the context of Aruna Shanbag case. But that is about clinical ethics. Nevertheless, it was a nurse and a fraternity of nurses who were responsible for this landmark paradigm shift in the Indian ecosystem of clinical ethics. Earlier, before that, there was no, euthanasia was not legal. Later in 2018, they made it legal, passive euthanasia under certain conditions. So, not like Florence Nightingale, but Aruna Shanbag also had a major role to play in several policies which are, in ethics. So today's talk is on so the objectives will be, for those who have not heard about any ethics, this is going to focus only on research ethics. Why we need to know about ethics? Why are we sitting here in an afternoon, pre-lunch on a Friday, right? KGF is there, Beast is there. We have left all that and standing here talking about ethics. So we'll just come to know now. After this, you will either curse me or you will praise me. Basic principles of ethics, just a foundation, just a few, just the basics of ethics. And important concepts in research ethics as students and as researchers. My previous speakers, Dr. Vinita and Dr. Sita Lakshmi, had nicely elucidated on the importance of research and the quality of accreditation and research. They've nicely combined and they told you the significance of research. But in my humble opinion, any research, the foundation is going to be ethics. So as researchers, if you want to go to do your PhD, or if you want to go to abroad or in India, whatever you do, your basic tenet is going to be ethics. Who's this? Familiar? Any movie actor or? No? Okay, you can just park this thought. This is just going to be with you. I'm going to give the answer at the end of the talk. If you don't sleep, you will get to know the answer, right? If you sleep, you're the loser. Right. The past. What happened in the past? All of us know the various human experimentation which took place in the Nazi camp. Right? Some of you are familiar with that. How the end point of all these trials among prisoners were death. It was death. So some of the, you can see here, there is a person who is immersed in cold water. They wanted to see until what freezing temperature the human body can survive. So the end point of all these experiments were death, right? Similarly, another person was hung in high altitude and they wanted to see up to which height the human body can survive. So these were the experiments that were conducted in the Nazi camp. These were among children, these were among prisoners, women. No one was spared. Some of you are aware of the Tuskegee human study. This happened in Alabama in the US, where they wanted to study the natural history of syphilis. What they did, they recruited African American, the black men, not women, only the men, and they kept on following up these people in spite of the fact that penicillin was invented by them. So they wanted to study the natural history of disease. So they did this experiment or study for 42 years or 40 years until a whistleblower came up and said, hey, this is wrong. Penicillin is already invented. There are many other drugs which are invented for syphilis. Why don't you give them? Right? But they were not treated. In addition to that, they were kind of deceived, saying that they have bad blood and all their samples were collected. So why all this happening? Why I'm saying all this? Because this led to a lot of guidelines, right? The Nuremberg Code, right? And several other ethical guidelines in the world for research ethics. And later, Bill Clinton apologized to the survivors and he paid them a huge compensation in 1997. This is in the past. So what is happening in the present? There are a lot of drug trials which are happening without consent, without any proper documentation, without any regulatory approvals. And recently, if you have been keeping track of the news on COVID-19, like initially there was like an article which said hydroxychloroquine is very effective. And later, these articles were withdrawn from major journals like Lancet and New England Journal of Medicine, on the account that this data is not authentic because nobody could verify the authenticity or the veracity of the study or the data. So such things can happen even today. There are many more examples, but lack of time, I'm not going to go into it. So what I want to emphasize here is even today, ethical or unethical experiments or research are very rampant. And as health professionals, it is our responsibility to make sure at least what we do is ethical. So research already has been emphasized is for the larger good of the community. So whatever you do, right, whatever little bit you can do to the community, it has to be done ethically. So any research here, I just want to emphasize is a set of do's and don'ts, which is important for the larger good to the community. And make sure the research we do balances the risk versus benefit to whom? To you? To whom? Investigator, doctor, nurses? For the research participants. So whatever you do, make sure it benefits the participants more than the risk that you're exposing them to. So when it comes to research and ethics, always choose ethics. So any topic that you choose, you think whether I will be a participant to it, will I be part of the study, or will I allow my loved ones to be part of the study? Will I allow my parents or my child or my spouse to be part of the study? If the answer is yes, then maybe the research question is ethical, right? So that is kind of a litmus test which I do when I conceive a research question. Will I be part of this study? Will I be comfortable answering this question? If I say yes, then it's okay, right? So coming to the principles, there are 4 principles to ethics. This should be like, even in your sleep, you should be able to answer this question. So will you answer it now? What are the 4 principles of ethics? Autonomy, justice, beneficence, and non-beneficence. Autonomy means voluntariness, which means you have the right to decide whether I want to be part of the study or not. You have to give that respect to the research participant. Justice means treating everybody equally, whether he is rich or poor, whether he is willing to be part of your study, he is not willing to be part of study. You have to treat him or her equally. Beneficence is doing good, and non-maleficence is doing no harm. So that will be the basic dictum of not just our research, but our day-to-day life. We are not going to harm anybody. So these are the 4 basic principles which you will keep in mind when you are following your ethics in doing research. So just from conceiving, from A to Z, starting from choosing your topic, I would suggest keep it very relevant to the Indian context, because we are a resource poor setting. Whatever said and done, we are still a developed, not a developed country, we are a middle income country, right? So relevance to the Indian context. And if you are going to have a study population, which are like, either a women or children or terminally ill, take extra care. These are called vulnerable population. So you need to take extra care. The ethics committee will tell you how to take consent and how to offer them extra protection. When writing the protocol, don't be too ambitious. There is a statistician who is going to tell you what is your sample size. If your sample size is just 100, stick to it, right? Don't be over ambitious and say, I'm going to study 1,000 people. It is not going to make any difference, because 100 is as good as 1,000, because your statistician has given that sample size and it is going to have adequate power for you to generate the plausible conclusion. So why we need to have adequate sample size? For example, you're doing a study on diabetes and you're claiming I have studied only 30 people. Is it right or wrong? Your sample size is 100, but you're saying I got only 30 samples. What will happen? Yeah? Can you generalize this to the general population? No, it is inadequate, and diabetes is such a common condition. You cannot say I didn't get adequate cases. Can you? So what will happen is, again, you're going to waste resources. 30 people ku neenga pandra study, adukana kaasu, adukana time, effort, everything will go waste for nothing. You're not going to draw any conclusion out of this. Similarly, if it is going to be a higher sample, same story. You're going to waste money on studying 1,000 people, which you could have completed in 100 sample size. So don't keep your sample size too high or too small, right? So make it correctly, whatever the statistician is giving you. And especially when you're designing longitudinal studies, you're asking the patient to come again and again. You're doing an intervention, you're doing some kind of therapy, right? In labor ward or in the community. But you're asking the participant to come 3 or 4 times. Make sure you are compensating the participant adequately. Don't make him or her come again and again for unnecessary investigations, just for your research. I want to take one more questionnaire. I want to take one more hemoglobin. I want to see the effectiveness of my intervention. So don't make the participant pay. It is unethical. Even when you're drawing your protocol, have this in your budget. These are the number of visits and this is how I'm going to fund it. Right? Don't make the participant pay. Randomization, if it is going to be an RCT, randomized controlled trial, take the consent even before randomization, because the participant will not know whether I'm going to be in the study arm or in the control arm, right? The participant should know, yes, I have equal chance of being either in the study arm or in the control arm. So you have to take consent prior to randomization and budget all patient-related expenses. Any additional investigations or tests, please budget. Don't make the patient pay. He is not obligated to spend for your thesis or for your research. Okay. Data collection, whenever you're collecting data, make sure the patient has the right to say no. He may not be comfortable with answering certain questions. So if he says no, let him be. Include another participant who is going to consent for your research. And when you are collecting data, for example, you're going for a school health program, you're collecting data, you're asking about, you're doing some kind of, you're asking about, say, for example, substance abuse. That is your research. Not all the participants will be comfortable. So make sure you give them adequate privacy. Don't ask in front of his classmates. Nobody is going to answer and he'll feel embarrassed to answer you. Take him or her to a private space, ensure privacy, and then ask these questions, right? That is called privacy. And after you collect the data, you keep it safely. You don't keep it on your table, or if you're going to collect it on the computer, like, an online questionnaire, don't leave it open, right? So all confidentiality will be lost. Everybody will know who is the participant, his identity, his answers, his illness, everything. So if it is for the patient, then it is called privacy. And if it is for the data, then it is called confidentiality. Keep it under lock and key. If it is a soft copy, then keep it with a password, protect it with a password. Data analysis and reporting. I'm just going to touch upon this again. Research misconduct is a very, very rampant problem in our research community. We need to be extra careful. While dealing with that, I'm going to talk a little bit in detail about that later. So I'm just skipping it for now. So in bioethics, two things are very important. One is the ethics review, which is done by the ethical institution, human ethics, or the animal ethics committee. I'm not sure if any of you do animal research, but many of you do human research. So you all visit the ethics committee, and some of your staff faculty are part of the ethics committee also. And madam herself has completed her postgraduate diploma in bioethics. So you should take example from her, because she thinks like, how important it is, right? So you come to the ethics committee for your proposal review. So the ethics review is done by the ethics committee. What as investigator you do is informed consent. What is informed consent? What is informed consent? There are two terms here, informed and consent, which means what? You have to explain, make sure the participant understands, and then ask him or her if he's really wanting to be part of the study. Don't say, Amma, he doesn't even know he's signing his own bill, right? Nobody knows. That's all. So that is not consent. So informed consent, researcher provides information, participant comprehends and voluntarily consents, which means it is not coercion. You're not forcing him to consent. He voluntarily consents. It's a process, which means patient you won't ask. He will be scared. I have to participate. No, it is a process. Every time he or she comes, you ensure that the consent is still there. Are you still willing to be part of the study? You have to reassure and kind of ask again and again if he is willing to be part of the studies. And all elements should be included. I'll just tell you what elements. Local language in simple terms. Phase 3, randomized, double-blind, placebo control. Purida? Participant you have to explain in simple terms. Don't use any scientific jargons in the consent form. One copy will always be with the participant, and more importantly, you have to have a regional language consent. What is the regional language of Coimbatore? French, Tamil, and some Malayalam, right? Some Malayalam patients also come to us. So you need to have a consent in Tamil. One important message I need to tell you here, don't use Google translation. Please don't use. Why? It will change the meaning entirely. I forgot to add a example, but I'm just telling you as a small example what we have. Sterile plastic. How will you translate in Tamil? Suttikarikapatta plastic. That's what we think. You know what Google God thinks? He thinks malatta plastic. Okay, sterile means also infertile, right? So it translates as malatta plastic. If I say junk food, it gives me kuppai unavu. These are all real examples, okay? I have an entire consent form written like this from one of the students. So don't use Google Translation. Get it translated. If you don't know Tamil, ask somebody to translate for you and give it to some of your friends or give it to your enemy who will be more critical, right? Right? So give it to such people and ask them to find what it is. Is it okay? And things like that. Then you come to the ethics committee, right? Otherwise, if you give such informed consent documents to the participant, he may not understand. The whole purpose is defeated. Okay. And most important, another important thing as nurses, like when you are in the clinic or a hospital, sometimes you take consent for the procedure, right? So that is not a replacement for informed consent. That is not a replacement. You can't say consent eduthutten, X-ray eduthutingla, MRI eduthachu. You're taking consent only for the procedure. You're not taking consent for using the data for your research. MRI la irundhu irukra data unga research ku use pandradhukku you have not taken consent. So that is a separate document altogether. What you take for your procedure, lumbar puncture or hemoglobin or any other test, is not the same as an informed consent. These are two different aspects. So please make sure you take additional informed consent for research, for using the data for your research. Will you remember this? Yes, good. So what it has to have? Contents. We have a template in the ethics office. You can also take it. In addition to that, if you think your process, your project needs an extra additional information, you can add these. Nature of the study. Is enna madri study? எவ்வளோ பேர் இதுல இருக்காங்க, ஏன் உங்களை நாங்க சூஸ் பண்றோம், all that will be there. What kind of study design? If it is an RCT, you need to explain here. You have equal chance of being in the control group or in the experimental group. Duration of the participation. Even if it is going to be 10 minutes interview, you have to mention it. What are the risks involved? இதுல participate பண்றதால உங்களுக்கு என்ன risk? இருந்தா riskன்னு சொல்லணும். Right? Whatever risk is involved, you have to explain. And what are the benefits? Risk matram kadiyadu, but there are benefits also in this study. If you are being part of the study, you have to explain the benefits. So what could be the benefit? Or what could be the risk first? Can you tell me what could be the risk? Sorry? Side effects of drugs. Yes, if it is a drug trial. Otherwise, if it is not a drug trial, it's just a questionnaire, or it's a longitudinal study, as I told you. What are the time? Okay, it could be an emotional risk or psychological risk, right? So such things you need to explain. Make it very clear. Make sure the participant understands what he or she is getting into. And then the benefits. Benefits could be cure, possible cure, or some kind of improvement in the pain, or better knowledge, or it need not be a direct benefit. It could be a benefit to the larger community, right? That also you can mention there. Any injury and compensation, this is more emphasized right now in regulatory trials, which is sponsored by a pharma company. But our institution, we need to have a policy to address this if a participant has some other injury when he or she is part of your study. Okay, because of blood, if you take, for example, blood எடுக்கிறப்போ மயக்கம் போட்டு விழுந்துறாங்க, அடிபட்டுருச்சு, அப்ப யார் ட்ரீட் பண்ணுவா? We are only responsible, right? So you have to have these things in the informed consent forms. Availability of treatment. Even if he is not consenting, you should say his care will continue. நீ ட்ரீட்மெண்ட் இல்ல, நீ கன்சென்ட் பண்ணல, நான் வீட்டுக்கு அனுப்பிச்சிடுவேன், என்கிட்ட வராத அப்படி சொல்ல முடியாது. Still your treatment will be there. So you have to reassure and document it in the consent. Confidentiality is very important. How his identity will be protected, how the document will be protected under lock and key. If it is on the computer, it is password protected. Except for the research team, nobody else will have access to the details that you have collected from a research participant. That has to be clear in the consent. information or the contact information of the PI, the principal investigator, the researchers, and the ethics committee should be there. Right? Sometimes we do get calls in the ethics committee from participants. நிறைய blood எடுக்கிறாங்க. 4 ml தான் கன்சென்ட்ல இருக்கு, ஆனா இவர் வந்து 7 ml எடுக்கிறார். As if we are all vampires. ஏன்? ஏன்னா 4 ml சீரம் செப்பரேட் பண்ண முடியல. So that research fellow said, அதனால 7 ml எடுத்தார். Before they kill you, you please come back. I told him like that. He came back and we amended the consent form, made it into 7 ml so that they are knowing what they are getting into. 7 ml veno. They agreed. Whoever agreed, he took the blood and completed his study. So they do call. The participants do call the ethics committee. Voluntariness, which means na suya ninaivoda ida I am agreeing, not because you are giving me money, not because you are my doctor or nurse. I am consenting with my full consciousness. Okay, that line should be there and signature should be there. Consent in different situations. School health பேசுறீங்க. School healthல போறப்போ சின்ன குழந்தைங்க இருப்பாங்க, less than 18 years. So you need to take what is called as assent and parental consent. Assent அப்படின்னா குழந்தைங்க கிட்ட இருந்து we have to take consent. From 7 to 12 years we should ask oral assent. 13 to 18 years you have to take a written assent from the children as well as parental consent. So 2 consent documents you need to have. Community. In community la poi or a tribal area la poi hemoglobinopathies or you're doing some anemia study. You cannot directly go to the community. You need to take a permission from the community leader. That is called gatekeeper's permission. PhD ulla vanda yaar irukka munnadi? Security. Ella gateல security irukanga. Avula தாண்டி வர முடியுமா நீங்க? வரவே முடியாது. இல்ல? அதே மாதிரி தான். கம்யூனிட்டில போய் community leaders கிட்ட you have to get permission. Only then you can take the consent from the individuals, right? And it's not a replacement. நான் வந்து உங்க தலைவர் கிட்ட பேசிட்டேன், அதனால நீ consent பண்ணணும் அப்படி சொல்ல முடியாது. It's not a replacement. You have to take both. You have to take permission from the gatekeeper, that is the community leader, as well as the individual consent. When somebody is in ICU or critically ill, how will you take consent? Somebody who is legally authorized or acceptable. LAR, we call it LAR, legally acceptable representative. Okay, so usually it's the children or spouse, they are the legally acceptable representatives. That is called surrogate consent. Patient who is on ventilator cannot consent, so you are taking consent from the relatives who is legally acceptable. Pakathu vittukarangittyo illa eduthu vittukarangittyo you cannot get. It should be legally acceptable. Okay, once this patient is fine, he opens his eyes, நான் எங்க இருக்கேன் அப்படின்னு கேட்கிறாருன்னு வச்சுக்கோங்க. You have to take a reconsent. You cannot say நான் ஆல்ரெடி உங்க வைஃப் கிட்ட இருந்து வாங்கிட்டேன், கிட்ட கன்சென்ட் வாங்க முடியாது சொல்ல முடியாது. Right? You have to take a reconsent. I'm still willing to be part of this study. Right? So these are different situations, how consent is different. Next is just case scenarios. It's publication ethics. I'm just going to touch upon 3 cases. The last date of submission of thesis is 29th April 2022. Now, last minute work for PG realizes that she is far behind the schedule, and the guide has given some suggestions to be made. Guide oda vela enna revise pannite irukka. I also do that, right? Keep revising. He or she goes over the articles he has and copies a few lines. Vera ketite irukka nam enna pannalam, copy paste. இருந்து கொஞ்சம் 5 lines copy பண்ணி இங்க பேஸ்ட் பண்ணிடலாம். டைம் இல்ல, 29th குள்ள சப்மிட் பண்ணணும் இல்லையா? இன்னும் ஒரு வாரம் தான் இருக்கு. And as he did not have time to think and write. Your thoughts? Right or wrong? இது பேர் என்ன? Very good. It's right or wrong? It's wrong. Okay, whatever you do, you give acknowledgement or you give reference in the source for where you took. Ideally, you need to grasp the concept and write it in your own language. But certain things you cannot change. For example, definition. Definition of health is what? Okay. Ella community medicine nalla padichirukeenga. Okay. So adla irukra definition neenga maatha mudiyadhu. It is not your exam paper where you write your own definition, right? It is a thesis or a project report where you have to quote accurately what the definition is. Then you can refer to the source, and up to a certain percentage, this plagiarism is allowed by different universities. Okay. So it's called to kidnap. Plagiarism means to kidnap. It's not just words, it could be ideas, or it could be images, or it could be even concepts that also can be stolen. That is called plagiarism. It is wrong. And UGC has passed a recent rule. We are not bound by UGC, I think, yet, but still, plagiarism is a punishable offense. An investigator completes his data analysis and finds out that the statistical analysis shows a p-value which is more than 0.05. என்ன பண்ணலாம் கரெக்டா தப்பா 0.05 இருக்கு இந்த மாதிரி ஆயிருக்கா உங்களுக்கு p-value is not significant, it's more than 0.05. அப்ப என்ன பண்றாரு கொஞ்சம் டேட்டாலாம் he deletes and he says okay இந்த டேட்டா மட்டும் அனலைஸ் பண்ணலாம் இது significant p-value வருது எனக்கு வந்து இது பப்ளிஷ் பண்ண முடியும் because the p-value is less than 0.05, so I can publish it easily. Your thoughts on it? Yeah, is it right or wrong? Wrong. How many of you say wrong? How many of you are sleeping? Okay. It is called data falsification. So first term you knew was what I told you is plagiarism. The second term is data falsification, where you can manipulate the data and images. Okay, which means data is actually collected. அந்த பையன் பாவம் எல்லாம் ஒழுங்கா கலெக்ட் பண்ணிருக்கான் பட் p-value significant வரல என்ன பண்றது கொஞ்சம் அங்கங்க tweak பண்ணி he is trying to reanalyze and bringing the p-value to less than 0.05 so that it gets published. He's collected the data, right? That is called data falsification. Third case, a PG is unable to meet the adequate sample size for his thesis. He is convinced that if he can get data for 50 patients, he can generalize it for 200 patients. That is a calculated sample size. Now, see how you are completing that? He decides to write down the sample size as 200. He is extrapolating it to 200 sample size. Is it right? Wrong. What is it called? Data fabrication. First on the falsification, you collect the data, but you edit it. Here, you don't even collect the data, but you extrapolate it or manipulate the entire data. That is called data fabrication. It could be even a fake data or fake images. Google தான் இருக்கார்ல எல்லாத்துக்கும் எல்லா இமேஜும் அதுல வரும் இல்லையா ஹிஸ்டோகெமிஸ்ட்ரினா அதுல வரும் சிடினா அதுல வரும் என்ன வேணா வரும் so you just copy and paste it there and ஒரு lesion போடணும் அப்படின்னா ஒரு 0.5 millimeter lesion you can draw if you're a good artist and you can publish your thesis, right? So that is called data fabrication. இப்போ வர answer எவ்வளவு பேர் முடிச்சிட்டு இருக்கீங்க? Remember this photo? Yes. His name is Eanthropus dawsoni. Who is he? He was discovered in 1910 to 12 in Sussex, England. So what they said, he's a bridge between the ancient man and the modern man. He was our ancestor. அப்படின்னு சொல்லி நம்மளால நம்ப வச்சாங்க ரொம்ப நாள் நம்மளால நம்பிட்டு இருந்தோம் and later in 1950s I think they discovered it is just a data. What did we learn? Manipulation. It's not real. They fused the human and the monkey skull, right? Orangutan skull, and they made us believe it is a bridge between the ancient Neanderthal and the modern man. And this was believed by many scientists until 1953. From 1910 to 1953, we were believing it. And this was, this concept was put forward. This skull was assembled by somebody called Dawson. That is why they named him after him, Eanthropus dawsoni. Okay, this is probably one of the first or earliest evidences of research misconduct. Okay, so this three, data fabrication, data falsification, and plagiarism is called research misconduct. Always keep in mind, you don't fall into this syndrome. Okay, there should not be plagiarism, there should not be data fabrication, and there should not be data falsification, right? So with that, I finish. Always try to protect your research participant. Always ethics is more important than your research. And you also saw what are the importance of informed consent in various situations and the contents of informed consent document. And always follow responsible conduct of research. ICMR has a separate small booklet on RCR, as well as a new chapter in responsible conduct of research. They've added in the recent guidelines this chapter, emphasizing the importance of responsible conduct of research. I urge you all to go and read ICMR guidelines for ethics biomedical research whenever you have time. It's open source, it's there in the ICMR website. So, any questions? I knew this. I confidently put that image, right? So, thank you. Thank you very much, and wish you all the best for the rest of the conference. And thank you for the opportunity once again.
So now we give more concentration to the collaborative research, because after this pandemic, we had a lot of sessions about collaborative, even though it started long before. But how far in our nursing we are taking up this collaborative research? Why we need to have this collaborative research, and how are we going to collaborate it? And what Dr. Sudha Ramalingam has clearly said, what are the ethics we need to follow, especially when we do the collaborative research, and how to have a agreement and all. And recently, 2 weeks back, there is a WhatsApp, we have an Indian nurse scientist, where the PhD holders of the people of our India, who is living in all over the world, we had a Zoom meeting after a year thought, and to going for the collaborative research all over the world, how we can choose the topic so that data can be collected in different parts of the world, which can bring some changes in the policy system or changes in the evidence-based practice like that. So having that, we have taken the initiative. And so I don't know how far it is going to work, but we need to consider there are many aspects. So that's the one which we always say, that having this, sharing the ideas and listening to. You work with me, I'll work with you. When we all work together, we get the things done, is it not? And sometimes working together is much more fun. We need to enjoy in the group. இப்போ சாப்பிட்டு முடிச்சுட்டு நீங்க ரொம்ப டல்லா இருக்கீங்க, மேடம் சொன்னாங்க பிஃபோர் த லஞ்ச் தூங்கிடாதீங்கன்னு சொன்னாங்க. அப்ப கூட பசி மயக்கத்துல தூக்கம் வருமாங்கிறத விட சாப்பிட்டோன்னா when the stomach is full, we tend to sleep, இல்லையா? So again, it's a challenge for me, like I have to make you all to wake up. So how are we going to do that? As researchers today, we really have increase in importance for this segment. The avenues for the nursing is expanding. So nurses are now wanting to do a research with the most diverse problems and where we observe clients, because ma'am, Vinitha Ravindra ma'am said clinical side la nama eppadi pannanom abingiradha. So most of the time our PhD holders or master students are at the UG level, we go in for the quantitative data with teaching or assessment and the madam pandrom. Clinical data nama poradilla. Unless we do the clinical, we will not be able to go in for the evidence-based practice. Evidence-based practice ponana we will be able to improve the quality of the care. So adumari we have to do that. That we need to think of it. And also we cannot do only with our nursing. We need to collaborate with the other disciplines and the research solutions so that we'll be able to come up with our nursing profession. So these activities are being increased nowadays across the healthcare settings. And there is chance for a lot of having a mutual outcomes will be much better when we do the collaborative research. But designing and conducting the international collaboration, that is the most important. Not only collaborating with the state level or national level, also go for the international collaboration, which provides the opportunities for us to have more of knowledge about the countries, different countries, how their culture, how their care of patients, how they are doing it, what is the nurse's role there, how they are expanding their practice, everything it should be there. And with that, we can see how we can solve the problems of our country too. So during this pandemic also, there are a lot of research studies being done. May not be followed the research ethics follow pannangalan theriyala. Romba studies they have done it. And they published a lot of papers, if you see that COVID-19 la, how each country has faced it. And some problems what has been suggested by different countries, we were able to implement in our country. What we have implemented in our country, the other countries have copied too. Example, the COVID vaccination coverage, the awareness created by the people, that was more. They were able to collaborate. The team of healthcare team able to collaborate and make it successful. It is not only the nurses, doctors or anyone. It is a team who have worked together to fight against the COVID. That is a collaborative.
So same way, this in our international collaboration is a useful tool which will be able to bring the capacity building to tackle any of the complex problems in a variety of perspectives. That's most important having this. So as we knew that, just to say what is research, we are going to consider the problem in a particular, the concern on what we have and how are we going to solve the problem. There is a difference between problem solving and research. So we have learned the basics. I'm sure that third year BSc nursing students and master students and things, you have learned the difference between problem solving and the research. So whatever the problem is there, you may go into the steps of research process so that you will be able to do the research. So here, collaborative research involving the coordination. It is the research, but you involve the coordination between two or more people. It may be in your institution, or it may be the organization, or in the community, or the outside the committee, or in the state with other university people, or with the nation. Maybe I may collaborate with the College of Nursing in the North India. I may have the agreement, we may go ahead with that. Or I may have an international collaboration. As we said, the PhD College of Nursing has MOUs with many countries, where we have the Lazos and Hezo University in Switzerland, and in Ethiopia, Bulgaria University, and in Indonesia, there are Jakarta, there are 3 universities. So what is our MOU says is mainly exchange of the lectures and the collaboration of the research, faculty, and student exchange program. So here the collaborative research goes on. So where we have an MOU agreement, who will be the author, first author, who will be the next author, who will be funding it. So we need to be very clear, the roles and responsibilities to be defined clearly so that it becomes easy. Otherwise, it becomes difficult for the collaborative research. So this collaboration, the academic research means an equal partnership should be there between the two people. That is what is most important. So why we need to have collaboration? Collaboration menuma research, whether you will do independently or you need someone. Usually we do independent research at the UG level, PG level, but why we go in for the collaborative research? To bring about any change, upon you need to have more idea that where, how it is happening there, how it's happening here, what is the idea we can come about it, and if we implement it, how it is going to help us. That is what is the thing. So it is a way the team works together, it is going to improve it. And it leads for more innovation. If you engineering student collaborate panna, any new equipment which you wanted, suppose temperature check pandradhukku ipo ellame touch method la vandiruchu illingla. So you can collaborate it with your idea being a nursing personal healthcare illayum avanga na rendu per sendu vandu you can collaborate some new equipments, some new or I can say new inventions can be done. Ipo neenga educate pandradhukke vandu you are using appala flashcards, posters idha irukku. இப்போ எல்லாமே வந்துட்டு இன்ஃபோகிராஃபிக் மெத்தட்ஸ்ல நம்ம யூஸ் பண்ண ஆரம்பிச்சிட்டோம். ஹவ் எஃபெக்டிவ் நீங்க இது பண்ணலாம், பப்ளிக் கிட்ட போய் கேட்கலாம். ஸோ தட் லாட் ஆஃப் வேஸ் விச் பிரிங்ஸ் இன்னோவேஷன் அமங் ஆர் யங்கர் ஜெனரேஷன் and it becomes more efficient process which increase the success is much more better when we go for the collaborative research, which improves the communication. So not only you communicate with your own team of people, where you tend to meet the different cadre of people and you have a communication with them, so it improves the communication skills. Listening to and learning from team members, that is the most important. Any communication, listening is the most. I'm really happy and proud to say that you are a good listeners. So so that means you have a good listening skill. One of the skill for the listening is nodding your head, as we say that also. So I could see the smiles too. So that's the thing, like it improves your listening and learning from the team members, helps each other to achieve the goal, what is it at the end of it. And why we need to have this collaborative research? Because as I said, it is going to establish an effective communication partnership, equal opportunity among the team members that will be there, and which honors and respect each member who's been involved in the collaborative research at the organization style, increases the ethical conduct maintaining. That is your honesty, integrity, justice, transparency, and confidentiality. That increases. And what are the elements of collaboration if you see that? It is, you have to establish a channels for communication, where the participant need to take opportunity for the renewal of their system. Second, you have to engage all the partners. Not only, same simple example, the UG level of the group project, the research project. அதையும் நீங்க நினைச்சீங்கன்னா like you have to tell each one their roles and responsibilities. Otherwise only one person will be doing everything, but the marks are given for all 5 of them the same marks. You need to differentiate. So அது எப்படி பண்றதுன்னா we must have a tool for it. How the involvement in the beginning itself you have to assign the roles. You do this, you do that. So assigning the roles and responsibilities, they are very particular, and with the team they work together, they achieve the goal. So that should be there. And identify the stakeholders which can serve as a feedback loop as it will understand the cause and effect. And you collaborate with the clarity of the roles. That is most important is clarification of the roles and responsibilities. இப்போ அது கொடுக்கலன்னா என்ன ஆகும்? ஐயா நானும் அடிச்சுப்பாங்க இல்லையா? நான் தான் பண்ண, my name should be there, your name should not be there. So much problems comes. So we have to clearly give the roles and responsibilities before we start this collaborative research. And to establish a professional environment to respect the different cultures, because I said international collaboration also. The culture is going to be different from each place. So we need to respect their own culture also. So what are the things? When we take it up for the organization, it provides a team with the support for access to the education and coaching which develops the collaboration for the organization. Second, the organization where you are going to have it, which ensures that there is a unrestricted to structured forums, such as ethics committee has been available at the time whenever you need it. The resources are possible. And whenever possible, if any dispute arises between the researchers, it have to be resolved. You have to resolve the disputes. And among all the critical participants, the patients or families, because Dr. Sudha Ramaningam said, no, during the data collection, even they can call up to the ethics committee and they say that I'm not willing, then we have to stop it. We cannot force anyone to do that. So that to be solved by the ethics team. So even if the family or the healthcare team. For the individuals as such, you see that every team member embraces the true collaboration is an ongoing process, and they invest in its development, ensure that they have a culture of collaboration. That means you have to contribute. You will not sit just like that. As a member, you have to contribute your own points to achieve the common goals by giving the power and each person's voice to be there. You need to accept their suggestions and integrating each one's the points and the differences, resolve the competing interest, safeguarding the essential contribution in order to achieve the optimal goals. So as a team member, master your skill communication. That is the essential element I told you. Communication is the most. And each team member must demonstrate the competencies which are appropriate to the role and responsibility. Whatever has been given to you, you have to be competent enough to do it. If I'm giving you some assignment to do that, you have to develop your competency in doing that particular assignment. That is what to be more specific. And here the nurses and doctors, the equal partners. It is not that doctors is one step high and we are one step low. When we go for the collaboration, this one, we are all equal. So, okay, that mind should be there. So we are the equal partners in modeling and fostering the true collaboration. Whomever with you are doing it, all will be in the equal cadre. That should be treated. And there are different kinds of collaboration. One is the interdisciplinary. That means you will have a team of researchers within the same department. If you have a third year research group, your 5 members are there. Is it not? Within your team members, your team, that is interdisciplinary. Team of researchers within the same department. Interdisciplinary means a team of researchers of different department or different background. So you will have that. Multidisciplinary means team of researcher in the different disciplines. It may be of bioethics, it may be of the biomedical, it may be of the engineering, it may be of medical doctors, it may be of social worker, it may be of psychologists, whoever it may be. You will have the research with them also. That is called multidisciplinary. And transdisciplinary is the involvement of people from outside academia into the research process. Outside academia, not only in the academic institution or the organization, who are there in the social network. With that, when you do it also, that becomes a transdisciplinary. These are the different types of collaboration you can have. You can think of it, what type of collaboration you would like to have, intra or inter or multidisciplinary or transdisciplinary. What are the benefits? Why I should have this collaboration? As I told you in the beginning itself, where we will be able to exchange the ideas across the disciplines. Here they say across nursing, not only nursing, any discipline you will be able to collaborate it and do it. and where you bring your strength for the better funding opportunities. When we go for collaborative research, funding becomes more. For nursing research, funding is not much. Even though there are few agents are available, ICMR also gives a little fund for our nurse researchers, not like other professional people. So we have a lot of funding agencies, but if we go for the collaborative research where we can increase the funding opportunities and population of research interest, you will be able to access for it. And increase the sample size. As I told you that as we go for the collaboration, the sample size is going to be larger enough. The simple one I can say that even one of our fundamentals of nursing department, they took the study for the COVID, during COVID time, they want to explore the students' experience of this one. So they want to see in all the colleges, they wrote a letter asking for to collect the data from the students to permit and this one. Maybe around 10 to 12 colleges of different zones of Tamil Nadu, they have given the consent and the data will be collected. This is one of the collaborative research which we can say that, because all the students' opinion, which may help us to improve on our teaching pedagogies, which may help them to understand the students' feelings or how it was during the online and all. So that may help us to modify our teaching learning methods too. So like that also can be started with a simple one. And access to facilities, and where it comes with a higher quality of result. Instead of doing only for my students, 100 students, or if I do for 1,000 students of all around the Coimbatore or in the Tamil Nadu, that's going to have a good result, is it not? So that can be done. So access to the training or learning, based on that, we can also have going for the training skills, learning skills. If a new curriculum, I don't know how far it is going to be implemented from this 2022-23 length, if you see that they have devised a curriculum in such a way, it's a skill-based curriculum. They have semester system, and you have first time in India, we are going for the credit-based marks. It's a credit hours. It's a credit-based system, we are going for it. It's a new one. And also you have semester. With that, they have certain things are mandatory skills and certain things are optional and certain things are which you have to do it. So mandatory is compulsory for all the students to complete it. That goes in for the skill-based training. So, and we have to see how we are going to achieve that. That also maybe later, if anyone is there, you can take up that collaborative study also. Each state, how they are implementing this new curriculum, how effective it is. The comparison can be made with the old curriculum, how it was the results of the students' performance and the new curriculum. So many aspects we can do that so that we can improve further our own curriculum for the students' purpose. So this research which stimulates the dissemination of research information across the world. Next, one thing which I always feel that we do research as part of our curriculum requirement, but we fail to communicate. How far we are communicating our research findings to the people? How far we are implementing our research findings? So implementation of research findings to be done, that becomes the evidence-based practice. So it's not just doing the research, is not just enough. You need to communicate, communication of the research finding. How do you communicate? Through the publications. Okay. So many people may be learning your this one. Based on that, they will get an idea, they will go with that and they will do in their places. And they get the consent from you like this, I have gone through your study. Can I do the same thing? Can you help me in developing the tool of this one? So you give the consent and they do. So all that becomes a one, then you collect it. That is called as, what is that literature you call it as? There is a study which you say that you collect all the research in the particular topic done all over the world. Systematic review. Okay. So that can be done, which may help in for the evidence-based practice. So this helps to access the valuable new data sources as well as opportunities for us to increase both academic and real world impact. So what is happening? Because we sit in the classroom, we sit in one room, we think of our research doing this, or we go to the hospital, this one. So our circle is only a little. When we need to expand it, when we collaborate it, our view is going to be different. That's the reason. Like even I say, like in my nursing practice, they say that where I worked in different places of different countries of the world. And why you keep saying? I said meeting the new people and learning their culture and learning the teaching learning environment of everyone, that has given a lot of input for us to improve on ourselves. So that is what is needed. ஒரு இடத்துல உட்கார்ந்து இவங்க மட்டும் பார்த்தீங்கன்னா அவங்களோட இது மட்டும்தான் நமக்கு தெரியும். We may not know like we have to, and being nurses, we are really lucky also, where we have an opportunity to go nationally and internationally. So where you meet the people, you go for it. So that has bring a real world impact in you. What is real nursing அப்படிங்கிறது உங்களுக்கு இப்ப student periodல you may not realize it. And as you go, when you become graduated, when you become postgraduated or doctorate and this one, you will come to know how far it is there in our nursing. The people also will realize it. And always I say that we need to market ourselves. Whatever we do, we have to marketing. Market பண்ணலன்னா we will not be able to survive in the society. அதுதான் சார் நம்ம ரிசர்ச் பண்றோம்னாலும் if we don't communicate it, nobody knows it. Nurses இவ்வளவு தூரம் இருக்கிறாங்களா அப்படிங்கிறது they never knew. Even the public கிட்ட போய் சொல்லுங்க I've done my doctorate in nursing இருக்குன்னா அப்படியா நர்சஸ் டாக்டர் பண்ணலாமா அப்படின்னு கேட்பாங்க. ஸோ அவங்களோட நாலேஜ் வந்து இன்னுமே இதாகல. இதுக்கு நம்ம என்ன பண்ணணும்? whose mistake is that? It's we, is it not? So we need to market ourselves. How far our profession standards we can raise it only through our marketing and communication. For that, we need to have a collaborative research. Enter into all the fields. How we are, how the nurses, because we are the best. We are the best in the healthcare. So let enter into all the fields and do the collaborative research so that the nursing profession is going to be somewhere high in our world. Even though pandemic has taught the value of the nurses and the nursing, still we can do with our collaborative research. So here the individual academics can also gain a sense of competence and confidence. When you go for collaborative, you will have your own satisfaction and you'll be confident that you will be able to do alone also with our international colleagues. And that's what our children always express when we have international collaboration, where the students from Switzerland, they come here for 1 month. And where we have 20 students of those Swiss students and 10 students of our Indian students, our students. They will be together for 1 month. So they learn the culture of our students, our teaching learning pedagogy, and we learn their culture and their teaching. So that gives a real good opportunity for them. At the same time, when our students go from here to Switzerland for a month, and really mingling with, they have so many countries people partnership, so they mingle with all the country people and it becomes so easy like to share it, and those children are really coming up well in that. So at the same way, if we start with this collaborative research with the different people in the world, I'm sure like we will be more competent and confident in doing our research, and it encourages and goes for the more funding bodies actually. And the demands are there for more of collaborative research. You have to make the operational plan, communicate between different research groups, share the credit and money, holding the frequent meetings. You have to conduct the meetings so that it will be easy how far the process is going on, and always encourage the open communication. That is most important, because we don't give a chance for the people to communicate. That's what the minds of the people are thinking, that you have not given the chance for us. So always in a meeting, in a small group, when as a researchers you are there, give the chance for everyone to speak. That is what is most needed for the collaborative. So how are we going to go for the collaborative research, where we have to identify and data collection? This will be the same like our data collection procedure. And the challenges is sharing of credit and responsibility. After you join, that is should be there. And collaboration do not get initiated due to the unwillingness of sharing or working together. That should be there. And collaboration can be a frequent source of problem. It's not that easy. இப்போ வீட்டுல 2 பேர் இருந்தாலே சண்டை வரும் இல்லையா? அது தெரிஞ்சவங்க ஒரே வீட்டுல இருக்கிறோம், இல்ல ஒரே காலேஜ்ல எல்லாம் ஒர்க் பண்ண 5 வருஷமா இருந்தாலும் we fight with each other. You fight with your own brother, sister and மாதிரி. But it is unknown people. You all join together to achieve the goal. அப்படிங்கும்போது when you start collaborating it, I'm sure naturally you will come across with many of the misunderstandings, conflicts, how we need to solve it. We have to understand that. And this collaborative research takes away your valuable time, and number of challenges relate to the equity. Whether equal chance been given to everyone, how do you treat the people? That is most important, because inequitable nature of the some research collaboration is not simply the result of the oversights or bad habits. It is a product of the whole structural factors which reproduce and imbalances the power of the people, so that it will not become more effective. So collaborations are often get spoiled because of the misunderstanding among the participants who are involved with conducting the research because of the disagreement. Why misunderstanding? You don't agree with each other. There is a disagreement is there about what and when to publish, also due to discussion with the slow collaborator. I want to become the first author. You will be the co-author. The third, there may be many people will be involved. How are you going to acknowledge it? How you are going to put it up? So all that will go in for the disagreement. That should be made clearly before we go for the collaborative research. So sharing of the credit, including the publications. Disagreement can be there of sharing of resources and other benefits, example, funds or the training. And dealing with the difficult people, always we cannot have all the people to be so friendly, is it not? You may have a difficult people also. How we have some in a class, there may be a difficult students too. And more difficult people will be there, so we should know how to deal with this difficult people too. And the expectations. And whenever we make it, it should be very clear that you have a commitment to the project across the researcher at the start. And priorities might be different, which hence the commitment may be different. Some may leave in between and no communication, they don't play their roles also. In that, how are we going to deal with them also? You will have this solutions. So what you must have for all these problems, have a face-to-face meeting. Improve the trust, because trust is most important. If you first patient you develop the trust. So improve the trust among the people. Have a openness of your interpersonal communication, which is a core successful collaborative research. For collaborative research successful, what you must remember? Face-to-face communication. Improve your trust between each other. Have your interpersonal communication, openness in that. And be honor and respect for each member. You give respect to everyone. Okay? Give respect to everyone in the individual level and at the organization one. So collaborative research requires, again I said, ethical conduct is most important. Maintain the honesty, integrity, justice, transparency and confidentiality. So and build a good strong relationship among the partnership member. And it should be specified and collaborators should be committed to the areas where they need to cooperate. Collaboration should have a reasonable expectation of the research process and its outcome. And the key to successful is a good interpersonal connections. So challenges can be individual challenge, institutional challenge, challenges regarding funds and systemic. So individual means having a single author publications are given more credit as compared to the collaborative, is it not? And the institutional means there may be a difference of different approaches among the collaborating partners. Suppose, for example, we are going to collaborate with the industry at the institutional level. Difference may occur between the objectives, different hypotheses, cultural differences, etc. Industry your objectives vary. Being a healthcare team, your objective may be different. So that need to be there. And challenges regarding fund, you may get the less fund which may be granted for the research as compared to the research institutions. And also there may be less focus on the research and more teaching by the universities, which may again have a separation in the education research. This both will affect the funding. Systemic challenges means where the success of the scientist is prioritized by becoming the administrative head in the research institution rather than advancing research. So the manual work is being done by the laboratory assistants or the scientists mostly just come in. Sometimes the studies will be done based on the lab values. So lab values are patient blood samples laboratory technicians. But on the values study panni, we are interpreting it. So in what happens is the author who has taken the research and who has been credited, but you need to acknowledge the people who have really helped for it. So that is the thing. And when we see the collaborative research in our country globally, India is leading to 6th rank for the publication of research papers. Now, recently it has been said that we are good in the publication of research papers, not only nursing, it's for all over the world, the research publication. So, which we have grown in 14% at the global level at an average of 4%. So, India has been actively involved in bilateral science and technology agreements because we are very good in the technology too, with over 40 countries and has also participated in global mega projects such as CERN, the 30-meter telescope international observatory and the Gates Great Challenges. So what I always feel that as a team, when we work together, I'm sure the success is there with us. So collaboration among nurses and the staff ensures the more efficient, effective patient care. When we collaborate it, Even when you give a takeover, handing over and all those things, when you give all the information, it is going to help them. But if you miss any of the information, which may be leading into the issues for the problem, which may not improve the patient care. So we must collaborate it at the working level, then you collaborate it with the institutional level, go to the other interdepartmental, then go with the multidisciplinary and this one. So most important here is the team members who can develop in the practice. So whenever we go for it, we need to have an agreement, research agreement to set the roles and responsibilities of the parties, which will say that what is the work you have to do and what is the financial contribution. So, and second is when we make an agreement, who will be the authorship, how are we going to give the credit for them, what is the research accountability, what is the intellectual property, that is most important, and use of data, how we are going to use the data, data retention and preservation. So the different types of agreement, you have sub-awards, collaboration agreement, intellectual property agreement, data sharing plans, material transfer agreement, facility use agreements, and consulting agreements. So what is a sub-awards agreement now? What is the work to be done? Agreement la budget for the work enna how payments are to be made for the people. If any dispute arises, how it can be solved. So all should be there in the agreement. Collaboration agreement how we execute between the institutions irrespective of the sponsor funding the research. Intellectual property now, like when we, whatever it's been written to cover the invention or discoveries which may result from your collaboration. Here is who will be the ownership of that. It is a collaborative layer. Who will be the ownership for the intellectual property? You are the person who is connected there. So that should be more specific. Maybe for this research, I will be the person. For the next research, when we do it, she will be given the equal opportunity. Like that, there must be an agreement. Data sharing is how the data which has been collected, we are going to share it, by which we develop under a sponsored project, which will be made available to others requesting for the access. Material transfer means how we cover the situation which one collaborator owns the research material, such as chemical compound or biological substance, and has received a request from the another collaborator for samples of the material. How it can be that agreement to be made, and how we can use the facility, insurance and liability issues, the cost of access, ownership of intellectual property, limitation or restrictions. So there will be a consultant. Consultant works for the hire. He has no right for all the work which is being done by the team of people. Here, the data or informed collector, developed or any intellectual property of any kind, consultant won't have any rights. Okay, he may suggest it, that's all. He doesn't have any right to use our own data or anything. So with that, I say that collaborative research, unless we start it, we will not be able to succeed. So I encourage all of you to go in for the collaborative research. If not, may not be international collaboration. It may be starting with your own level with the interdisciplinary, then go for the interdisciplinary. Just a few, I'm completing with the 4 questions. Collaboration in academic research could include 2 equal partners in research program, a research project involving 3 or more individuals, the sharing of research materials and facilities, and all the above. All the above. Good. Can we clap as they answer correct? A major consideration in determining whether a collaboration exists is whether each collaborators provide equal funding to the project, each researcher makes a significant intellectual contribution to the project, collaborating researchers work together at the same institution. Each researcher makes a significant intellectual contribution to the project, right? A written agreement formalizing a collaboration should be signed because the rights and responsibilities of the collaboration would then be clearly detailed. The collaborators know to whom to send payments. Institution and federal agencies require them. Option A is the right. Rights and responsibilities of collaborators would then be clearly detailed. That's really good. So the last one, written agreements can be used to formalize certain aspects rather than entire scope of collaborations. True or false? True. That's really great. So great. A big applause to everyone. Thank you so much. So the collaborative research among the educators, the professional nursing societies, the local and international organizations could provide initiatives for improving and implementing the evidence-based practice. When we go for evidence-based practice, I'm sure like which is going to improve the quality of the patient's care and the people's health outcome. So with that, let me conclude with Dr. APJ Abdul Kalam because I love always his quotes. Never stop fighting until you arrive at your own destined place. That is the unique, that is you. Have an aim in life, continuously acquire the knowledge, work hard, and have perseverance to realize that life is great. You have life is to live, love your life, enjoy the life. Keep smiling, enjoy. Thank you so much.
So should I start at the beginning?
Yes, ma'am. You can proceed.
I'm unable to make it a slideshow, so I'll continue like this. Yeah.
Audible.
Audible, no? 1 second. Good afternoon, everyone. Because yes, especially in nursing, right from undergraduate nursing curriculum onwards, nurses are involved in research, and it is essential for us to understand what is bibliometrics and how it is useful for us. So, how many of you have heard about the word bibliometrics, citation analysis, H-index, impact factor, source normalized factor, journal rank indicator, TWIM impact, and all? We have heard all these words, but what's the level of understanding about it? Until unless I was given this topic to present, even I was not having an in-depth understanding about what is bibliometrics and how we should be conscious about the concepts of bibliometrics. So bibliometrics was started in the year 1917 itself. The historical review is saying that F.J. Cole and Nellie Yates presented the first recorded study on bibliometrics in 1917 in Science Progress. And in 1923, Halme was the first to use the expression statistical bibliography. And in 1969, one of the pioneers was Pritchard, who suggested the word bibliometrics. So only from 1969, the word bibliometrics was widely used. So what is the meaning and definition of bibliometrics? Biblio means books in Latin and Greek word. Metrics means measurement. So you're going to measure the books or you're going to measure the publications. That is the literal meaning of bibliometrics. So bibliometrics is the use of statistical methods to analyze books, articles, and other publications. And bibliometric methods are frequently used in the field of library and information science. The subfield of bibliometrics, which consists with the analysis of scientific publications, is also known as scientometrics. Let us see in detail about it. This is also further definition of bibliometrics, that is the application of quantitative analysis in the bibliographic references of the body of literature. And the British Standard Institution has described further as the application of mathematical and statistical methods in the study of the use of documents and statistical methods in the study of the use of documents and publication patterns. So you're going to understand the pattern of publication, the pattern of the readers using some statistical methods. So that is the meaning of bibliometric. And there are some laws which are being used in bibliometrics, that is Loftus inverse square law of productivity and Bradford's law of scattering of scientific papers, and of course the law of word occurrence. Don't break your head with all these laws. Let us see how it is being used. So how bibliometric analysis is done? They are using a technique for bibliometric analysis which is known as citation analysis. So citation analysis is a very commonly used methodology for bibliometrics, and it is based on constructing the citation graph, that is a network or graph representation of the citations between the documents. We will learn about it in detail. And bibliometric analysis takes up the journals, and they see the quantity of the journals, that is how many journals are being published, how many issues are there, how many readers are there, and the trends. It does the trends analysis. For that, it is using the publications. So publications, they take in which are all the major journals it has been published, which are all the source countries using it, and the trend quantity analysis, the type and where is it cited, who has cited it. All these analysis has been done. And they also analyze the authors, who are the major authors, and their articles are cited by how many people. And they also check for the key topics, keyword frequently used, and titles, common words, abstracts, what has been widely referred by the readers. So this is how they do the analysis. And who is using bibliometric? Many research fields are using bibliometric methods to explore the impact of their article and impact of a set of researchers, impact of a particular paper, and identify particularly impactful papers within a specific field of research. For example, if you have published a research in related to infertility, then they see that who are all the authors who are very popular in the particular field and what type of articles they have published and which article has been read widely by the people, what is the reason they are reading. This kind of analysis has been done. And the bibliometric studies also have the citation scores at the article level. That is, an article is read by how many people, from which countries, and from which background they have read. How many have referred it in their studies, utilized in their research. So this kind of analysis is done. So they will have the visitors number and blog entries, tags, and all these they will use. And for this, they use the sources Web of Science, that is hosted by Thomson Reuters company, and Scopus, which all of us know Elsevier is hosting Scopus index, and the Google Scholar. Google Scholar is also very commonly used because it's very easy to enter the articles in Google Scholar, which is published elsewhere. And how are bibliometrics used? It one of the many possible measures of research is being used, and it also uses peer review involvement, journal editorship, and the research grant applications. And bibliometrics is done with the help of a software. So there are several softwares which are available for bibliometric analysis, because manually it is very difficult to do it. Now that with the invent of artificial intelligence and big data analysis, all the history, the browsing history is being documented, and it will be matching it automatically. So the bibliometrics toolbox is one of the tool which was used, which is a programmed package, and it has developed TA Brooks to assist bibliometricians in preparing statistics from their own loaded data. And Bib Excel also was designed to assist in the analysis of the bibliographic data. And SiteSpace, it is freely available Java application for visualizing and analyzing the trends and patterns in scientific literature. Then RStudio, it is a free and open source software for data science, scientific research, and technical communication. So these are all some of the commonly used softwares. So these softwares detects the browsing history of the individuals, and if an article is published, who is browsing it, who is using it, where else it is cited, from which country, and the background of the authors who are using it. All those will be captured by these softwares. And application of biometrics, where all it has been applied. It is applied in the field of research, definitely, to study research trends and the growth of knowledge. And it is also applied to estimate comprehensiveness of the secondary periodicals. And it is used to identify the users of different subjects and to identify the authorship trends in documents in various subjects. And it is used to measure the usefulness of retrospective and current awareness services, to identify the past and present publishing trends as well as forecast future publishing trends, to develop experimental models, and to identify the core periodicals in different disciplines. You will see that it is seeing the publishing trend also, because an article may be very popular today, but after few years it may not remain popular. Other latest articles might have come, so they will be analyzing the past present trends of an article, how it has been utilized. Then it is also used to formulate staking and bidding policies, and to initiate effective multi-level networking system, to formulate collection development and management policy, to study obsolescence and dispersion of scientific literature, to study productivity of institutions, individuals, and disciplines, to develop norms for standardization, to design automated language processing for auto indexing, auto classification, and auto abstracting. All these you might have personally experienced also. If you read an article related to your area of specialization, it gives you number of articles whenever newly it has been appearing in the in the web. For example, I was just learning about the communication of with the COVID patients. Then whatever article published related to communication and COVID, it was appearing that so and so was presented a paper on length of stay of COVID patients. Like that, now everything related to COVID was appearing. Similarly, whichever subject you are searching, the related article, whenever it appears, it comes to your mail. So and so has published an article. So you also have published an article. You might be interested. Your article may be related to this. Would you like to connect with the author? Like that, no, we get the emails. So all these are possible because of the bibliometric analysis. And limitations are also there for bibliometrics because it is highly formula oriented. And bibliometry, for example, some journals may be accessible for the authors. They may be reading only selected journals. They may not be reading all the journals. Suppose if your article is not published in a popular journal, then the chances of getting read by many people are less. That doesn't mean that your article is of less value, because it is all based on the formula, based on the popular journals which have been referred, or based upon the accessibility of the authors for the journals. Some journals may be very costly where the people may not be able to access it. So we may not be able to access full text article published in costly subscribed journals. So the formula may not work out there if many people are not accessing it. So that is one of the disadvantage. And bibliometric study does not include the informal publications and communications. Therefore, the scientific development cannot be predicted properly. And bibliometrical references are taken for citation analysis study are all not always standardized. And this causes the problem while ranking the authors on the basis of the frequency of their getting citations. For example, the author S.R. Ranganathan has been cited variously as Siyali Ramamirtha Ranganathan, that is S. Ranganathan and S.R. Ranganathan. This may cause scattering of citations of same person works, because in some places they may be publishing it with initials in front, some at the back, and some places expansion, then it may be appearing many times. So like that, no, it may not be highly accurate. Then at the same time, it may also happen that there may be more than one author under the same name, and it may be difficult to distinguish them. For me itself, it happens. My name Lata Venkatesan is very common name. I think there is a Lata Venkatesan who is working somewhere in IIT, and she is publishing all the studies related to engineering, that too related to some frequencies, and some physics related articles are being published. So those articles, when I place Lata Venkatesan, those articles are appearing. So, but I am a different person. Sometimes the articles which, the intimations which I receive are related to physics, and I don't understand what it is. So like that, no, the authors in the same name might be confusing, and if you take the citation analysis and all, it may be from different field. So always you have to confirm it is you or some other author, or which author is being shown for the citation analysis. So these are all the limitations of bibliometrics. Now we'll see the citation analysis in depth, because bibliometrics uses citation analysis as the technique. So let us see this technique, how it has been used. So if you look at the history of citation analysis, it began in the year 1961, and that time it was known as Science Citation Index, and however, it was done manually initially until large-scale electronic databases and associated computer algorithms were able to cope with the vast number of documents in most bibliometric site collections. The first such algorithm for automated citation extraction indexing was done by CiteSeer, and Google's page rank is also based on the principle of citation analysis. Patent citation maps are also based upon citation analysis. However, one has to keep in mind that humans have been publishing and citing since very early in history, with individual works containing citations. And about citation analysis, if you see, it involves counting the number of times the article is cited by other works to measure the impact of publication of the author. And there is no single citation analysis tool that collects all publications and their cited references. There are multiple tools which are being used. For a thorough analysis of the impact of an author or publication, one needs to look into multiple databases. Like you look at only Google Scholar and you say that, oh, my H index is this much and your H index is very less. You cannot say like that. For me, it has personally happened. Somebody was quoting that, oh, I have my H index is very high and her H index is very less. Whereas one of my, somebody known to me was having around 200 citations or something. Whereas if you look at mine in the Google Scholar, it was less. But I add my articles in academia.edu, because in academia.edu you can upload full page article anytime, you can retrieve it. There my citations are around 750, something like that. So you cannot decide upon looking up to one particular citation analysis or one type of hosting website, and you cannot decide that this is the impact of the impact factor or the H index of the author. So we have to refer multiple websites or multiple databases. And the citation analysis definition goes like that: it is the process whereby the impact or quality of an article is assessed by counting the number of times the authors mention it in their work. I think it is self-explanatory, and the purpose is to find out how much impact a particular article or author has had by showing which other authors cited the work within their own papers. And the H index is one specific method utilizing citation analysis to determine an individual's impact. So H index will show the individual, the article published by individuals, how many times it has been quoted by others. And about H index, if you see, it was invented by George E. Hirsch, a physicist, in 2005. And he used an algorithm to calculate the quality and sustainability of the research output. So he calculated using number of publications and number of citations per output. If one particular article is there, if it is being used by, referred by minimum 10 people, then it appears in the H index. So at least n number of times. That is the formula. Asking for H index for examiners. So because they might have published some papers, but how is the popularity of the papers? What is the impact it has created? What is the H index of the author? All these are asked now for giving them multiple tasks related to research. And how to do the citation analysis? Web of Science provides access to the world's leading citation databases, and it searches over 10,000 journals from over 45 different languages across the sciences, social sciences, arts and humanities, way back files to from 1900. And the citations or footnotes allow one to navigate forward, backward, and through journal articles and both journal and book-based proceedings. It's Analyze, the name of the tool which used by the Web of Science is called Analyze. This tool helps in finding hidden trends and patterns and gain insight into the emerging fields of research, identify leading researchers, institutions, journals, and trace the history of a particular field of study. And the search types, how it uses is, it uses a simple search, cited reference search, and advanced search. These are the three different types of searches which Web of Science is using. Now coming to Scopus Index. How Scopus Index is establishing the indexes. Scopus is the largest abstract and citation database of peer-reviewed literature. And, it uses scientific journals, books, and conference proceedings also. Whereas in Web of Science, conference proceedings are not included. Whereas in Scopus, conference proceedings are also taken into consideration. So, delivering a comprehensive overview of the world's research output in the field of science, technology, medicine, social sciences, arts, and humanities. It develops a citation and it uses smart tools to track, analyze, and visualize the research, and it is hosted by Elsevier. And Scopus provides citation counts in it, but it takes up the articles published from the year 1996 onwards. And it indexes over 15,000 journals and over 4,000 international publishers from various disciplines. And to find the citation counts to your own article, once in Scopus, click on the author search tab. Then you will know your citation counts. Then Google Scholar. Google Scholar is very easily accessible because I personally use this. Because if you want to enter into Scopus or Web of Science, no publication, you have to publish it in the journals which has got publication charges. And the publication charges are very high. Sometimes we are not able to afford to publish in those kind of journals. So Google Scholar, no, you add the articles which is published elsewhere in any of the journal. So even our Tamil Nadu Nurses and Midwives Council journals, once you publish there, it gets automatically appeared in Google Scholar because they have linked in Google Scholar. So Google Scholar provides simple way to broadly search for scholarly literature, and from one place you can search across many disciplines and sources, articles, theses, books, abstracts, court opinions, and from the publishers, professional societies, online repositories, universities, and other websites. So Google Scholar helps you to find relevant across the world of scholarly research. And you can have your own Google Scholar page and you can upload manually the articles which you have published. You can upload full page article or you can only upload the citation. So this also gives you the H index. And Google Scholar provides citation counts for articles found within Google Scholar. Scholar is indexing more journals and more publication types than other databases. And that is citation analysis. Now coming to impact factor. What is impact factor? Impact factor is a measure of the frequency with which the average article in a journal has been cited in a particular year. So it is used to measure the importance or rank a journal. You must understand impact factor is for the journal, whereas citation analysis, which is resulting in H index, is for the author. So you have to publish in the journals which is having high impact factor. Why you have to publish it in high impact factor? Before publishing, check the impact factor. Why means that journal has got more reach to many readers. So the possibility of your article being read and the possibility that your article will be cited will be higher. So naturally your citation index, your H index will go high. So you have to look into the impact factor of the journal. And the impact factor is calculated based upon the number of readers reading it and then the number of the readers picking up articles published in particular journals and used in their research for citations, so as part of their citation. And how it has been calculated for impact factor, they use a formula to calculate the impact factor. That is, it is taking the all citations of previous 2 years. Suppose if you see the impact factor of Journal of Advanced Nursing this year means, it has taken the articles which were published for last 2 years. A number of times it is being cited divided by number of articles published in the year in the past 2 years. Like that it is calculating. So there are so many articles published during last 2 years, out of which this many articles were cited frequently. Like that it calculates the impact factor for a journal. And even prestigious journals publishes many non-cited articles. It doesn't mean that all the cited articles only are being presented. Not all articles in high impact journals are cited. There may be the article is published in high impact journal. It doesn't mean that your article has got high chance of getting cited and your H index will improve. As I told you, high impact journals may be highly costly also, and authors may not be able to read it, or they may not be able to download a free full text article. So they will not be able to quote it in their research. So you cannot equate the impact factor and the possibility of getting your article cited. So this is another one. I was also learning this newly. That is Shimago Journal Rank Factor, SJR indicator. What is this SJR indicator? This Shimago Journal and Country Rank is a publicly available portal that includes the journals and country scientific indicators developed from the information contained in Scopus database, which is hosted by LCDI. These indicators can be used to assess and analyze the scientific domains. Journals can be compared or analyzed separately, and country rankings may also be compared or analyzed separately. Journals can be grouped by subject area. They have identified 27 major thematic areas and subject category, that is 313 specific subject categories are used or by the country. So citation data is drawn from over 34,000 titles from more than 5,000 international publishers and the country performance metrics from 239 countries worldwide. So there is a journal rank indicator based on in which country which journal is popular. All the journals need not be popular in all the countries. And similarly, according to the subject area, which journal is popular. For example, you take nursing. In nursing, which journal is very popular, which has been popularly been referred? Maybe Nursing Journal of India, which is one of the oldest journal. We do not know. But when you do the journal rank indicator, you will know that in a particular country, in a particular area of specialty, which journal is top ranking. So this kind of ranking is being done. Like we have best-selling books, isn't it? We know, you know that if it is midwifery, many purchase Margaret Miles or DC Datta. So like that, you know that these are all the books which are commonly used by the students. So similarly, we do not know which are all the journals which are being commonly used. So the Shimago journal rank gives the ranking of the journals. That is country-wise, subject-wise. And it also allows you to embed significant journal metrics into your web as a clickable image widget. And this platform takes its name from the Shimago Journal Rank Indicator, developed by Shimago from the widely known algorithm Google PageRank. So Shimago is using Google PageRank for it. And this indicator shows the visibility of the journals contained in the Scopus database from 1996. And Shimago is a research group from Consiglio Superior de Investigaciones Científicas, University, Granada. It's done by this particular university. And there is also source normalized impact per paper. What is the source normalized impact per paper, in short known as SNIP? It measures the contextual citation impact by weighting the citations based on the total number of citations in a subject field. They take totally how many articles are cited, out of which this particular author, how many times it has been cited. Like that they estimate. So the impact of a single citation is given higher value in subject areas where citations are less likely and vice versa. Some subjects you will not have many articles, maybe few articles are there, so they will be repeated. So according to the availability of the articles, they are weighing the citation. That is source normalized impact per paper. And this factor was released in 2012 by Elsevier based on the scope, again based on the scopus to estimate the impact. And the measure is calculated as SNP is equal to RIP divided by R by M. R is the, that is raw impact per paper divided by citation potential and median database citation potential. So these are all the formulas. Maybe it is already fit into the software. So some area you may have many articles, some area you may not have articles at all. So according to the availability of the articles, how many times a particular article is being cited. That is the source normalized impact per paper. Sorry, immediacy index. What is journal immediacy index? That is, it tells you how often the articles are published in a journal or cited during their year of publication. This can be an indication how hot a journal is. And it is calculated by dividing the number of citations to articles published in a year by total number of articles published in that year. So this also you have to see some, because usually we have the tendency to cite the article which were published in the recent years. Especially we also tell the students, you quote the articles which were published in last 5 years. If articles are not available, then you can use retrospectively up to 10 years. But any article when we quote which was published 10 years before, then it is not been widely seen in any of the citations. So the immediacy index also, how immediately it has been cited, that is shown by immediacy index. Then cited half-life. What is cited half-life? We have heard about drug half-life, but not the cited half-life. So the median age of the articles published in this journal that were cited in 2004. Half the citations received in 2004 were to articles published in 1996 or later. So this is how they say, as I said, 5 years and 10 years. Suppose if I have published an article in 1995, after I completed my MSc, I published my thesis. That may not be cited now because it was published 20 years before or 25 years before. That doesn't hold any relevance now. So the number of people quoting those articles will be less. Whereas when they did this half-life, they saw that whatever was published and cited in 2004 was published almost 7-8 years before. So that is the half-life. That means after a period of 7 or 8 years, the citation index of your article will come down for the particular one, because it is going to become obsolete or it is going to become old data, and the chances of getting cited is going to become less. So your article, if you are publishing today, it has got a half-life. That means for next 4-5 years, it may be quoted by someone, cited by someone. After that, the chances of that your article will be cited by someone decreases. So that is the meaning of this cited half-life. And this is the impact factor trend graph. That is, it indicates the impact factor over a period of 5 years. If you see a journal, don't see the immediate impact factor, see the trend for the past 5 years. So this has also been done by Web of Science, and some of the journals may not be part of Web of Science, or some may not be part of the Google Scholar or the Scopus. Then the articles published before they became the member of these websites, it will be less. So this also it will influence the trend. So review your research area Pearl Groy. What is this? This is the ancestry approach. Acquiring a research paper and examining its references, backward searching. And that is, you are seeing backward how many times it was been used. Then identify a paper's offspring. That is, this is cross-referencing, that is, you take an article, in that you see the author has referred which are all the articles. Then you do the cross-referencing and you go get the original article. So this is the descendancy approach. So these are all the approaches you can use to find out the articles, because somebody else has used, and those who are reading the latest article see which are all the other articles which has formed the basis for the present article. So that way they may explore and take the older articles also. So that is known as pearl growing. Then determine the level of your achievements, that is H index. It is important to remember that current metrics such as the impact factor and immediacy index are based on journal evaluation, whereas the H index accounts for a researcher's body of work without the influence of other factors. So H index is for the author, impact factor is for the journal, immediacy index also how quickly the articles published in a particular journal is being quoted by other authors. So a scholar with a H index of H has published H papers, each of which has been cited by H times. So that is the meaning which I have already said. Suppose if the H index is 20 times the paper, the same paper is quoted 20 other researchers. So that is the meaning. So now you will understand why it is important to publish. You may be conducting research as part of your academic requirement or as part of your departmental requirement or out of your interest, or you got some funding, somebody asked you to do the research, whatever may be the purpose. If you are not publishing, it will not be accessible to other researchers. If not accessible to other researchers, then they will not be using it. If they are not using it, then your H index will not improve. So it is important to publish and publish it in the journals which is having maximum reach to the authors and which has got good impact factor. So there are the chances of your article getting cited will be better and your H index will go high. And your paper will be worthless if nobody is reading it, nobody is using it, or nobody is citing it. So that is why you have to publish your study. They also use median impact factor. Median impact factor is the impact factor midpoint for journals in the category, and 50% of the journals rank above and 50% rank below. And aggregate impact factor is the citation rate of the average article in a subject category. And they will use benchmarking. All these are little more advanced method of calculating the impact factor. There are also reasons because it is not possible for everybody to publish in a journal with high impact factor. Even if you publish, the chances of getting it cited is beyond the control of the journal or the author. Only if somebody does the research in that field, if they are accessible to that journal in that particular country, then they will be using it. Many countries, they will be using the articles published in their own language, like Spanish and other German. No, they publish in their own language. So maybe that has been quoted more in the people doing research in that particular country. So there are many factors which are influencing. So you cannot say that because an article is published in a particular journal, that is the reason there is impact factor is high or the citation index is high. It doesn't mean like that. So here they also use validity as a measure. So based on the arithmetic mean, for example, about 90% of Nature's 2004 impact factor for based on only a quarter for its publications, and thus the importance of any one publication will, and in most cases less than the overall number. Furthermore, the strength of the relationship between impact factors of journals and the citation rates of the papers therein has been steadily decreasing since articles began to be available digitally. Earlier, only few journals were there, they were manually published, so chances of reference was more, citation was more. But now it is digitally, you have n number of articles which are available. So all these are influencing the validity as a measure. And how meticulously they are relying upon the other authors and quoting it, it also will be influencing the impact factor. And editorial policies, editorial policies are there, reviewed, so many reviewers and it might get accepted, rejected, and the cost of publication, all these will be influencing. So the critics, they say that in 2007, one of the journals said that they have particularly done an analysis and they found their impact factor was much higher, whereas it was published as 0.66. So they were telling that who is calculating this impact factor and how they are calculating. Only if it is listed in their web or their own publishing site, then only it will be calculated. What about if it is not been included with them? So like that, no, lot of arguments and criticisms has arisen. So this is called coercive citation. That is, it is a practice in which editor forces an author to add spurious citation to an article before the journal will agree to publish it. So some journals may be influencing, no, you do this citation, which is this author is always publishing with us, and you please quote that author in your article. Like that, no, they may be using coercion to cite the articles which were published in their previous issues of their article by different authors. So that also can happen. And responses, this is the impact factor is not always a reliable instrument, which was that is in November 2007, the European Association of Science Editors issued an official statement recommending that journal impact factor are only measuring and comparing the influence of the entire journal, but not for the assessment of single papers, and certainly not for the assessment of researchers and research program. So you cannot devalue a researcher or a paper just because it is not cited. So sometimes we have seen due to multiple factors it may not have been cited. That doesn't mean that the researcher has not done the credible work or the output is not that much useful or valid. So there are multiple factors of influencing it. So these were all the arguments. And this page rank algorithm also in 1976, a recursive impact factor that gives citations from journals with high impact greater weight than citations from low impact journals was proposed. So such a recursive impact factor resembles Google's page rank algorithm. So if it appears in Google page rank algorithm, then it is a impact factor will be high. If it is not appearing, for example, when you do your Google review, you put a particular topic, you will have 10 pages. The articles related to that, but you will click the first page. In the first page itself, some 10 or 12 articles it may show. In that, whichever is applicable, you will select, and you will not be moving on to second page or third page or up to 10th page. No? We usually do not have time. Once we get article, we try to stop. So whichever article is getting the chance of appearing in the first page of Google search, it has got more chances to be read by the authors. So this is also one of the critics. Suppose little older article will go into page number 2 or 3, then the chances of the readers to use it will be less. And other level metrics, that is author level metrics, which is the H index, article level metrics that measures the impact at an article level instead of the journal level, and other more than alternative metrics are called as alt metrics, which may include article views, downloads, or mentions in social media. Nowadays, they are using this also. It is not necessary that your article has to be cited by an author in another article or a research paper or in their textbooks. It can be even mentioned in social media like Facebook, Twitter, Instagram. All those are also being taken into account. So tweets also, number of tweets are also counted. So they are publishing a factor called as impact factor. That is number of tweets it receives in the first 7 days of publication. And Twindex, that is the rank percentile of an article, impact factor. So like this, even social medias have started publishing it. And some people, they receive payment also, like in Instagram or YouTube. You publish it in YouTube, then number of viewers are there. If more number of viewers, you get some remuneration. So like that, even social media is creating a kind of impact. I published how to do a pregnancy test at home. It has got some millions of viewers. because many people want to do home testing of pregnancy, so there are million viewers, so they may be giving some factor that you have crossed this many viewers, some kind of incentive, YouTube will be giving you the report. So these are also a kind of citation reports or the impact factor we can take. So these are all coming up newly now, so you can think of having your own YouTube channels, your own Instagram pages, how many viewers, how many followers, how many people are at your work. All these are also being taken into consideration. Now, somewhere we saw that even people for recruiting, they are using how popular they are in social media. So they see the how popular, how frequently they are using the social media, and they are evaluating your performance through social media. All these are happening. So these are all some of the indirect or alternative methods of measuring the impact of your work which is arising. So with this, anything left more an in-depth analysis of what is bibliometrics we saw, and bibliometrics uses citation analysis, and citation analysis gives the H index for the author and impact factor for the journal, and based upon the impact factor, journals are being ranked. So journal ranking factor is also being used. So these are all widely used, and now social media is also giving a kind of impact figure. So anything left more? If there is anything left, please add on. And thanks for your patient listening.
Thank you for the informative session. On behalf of PSG College of Nursing, we thank you for joining us virtually.
Any questions from the audience? Thank you, Dr. Nirmala.
So shall we start a session? And before starting, I'd like to thank all the organizers for giving me this opportunity. Hope you can see me. This is blocking me. I'll stand here. The side is better. Okay, so we'll go into our session. Can you hear me? So the topic for my session, today's session, is integration of technology in nursing research. Technology in today's world, it's right from a 1 year child, from 1 year child to 80 or 90-year-old grandfather or grandmother. Everyone is involved with technology. So even 1 year baby, it knows how to use the cell phone. Yes or no? Even your small babies at home, 1 year or 2 year babies, they know how to use the cell phone. So this technology has become an integral part in our day-to-day life. So nursing research, so from morning you have been hearing about research. Hope it has all gone inside or it has gone up above. I don't know. But anyway, technology is the way of life today. So we'll see how technology is integrated in nursing research. Technology has changed the very fiber of the society we live in today, especially after COVID-19. We can see so much technological involvement, and all of you, I can bet that you will not live without your cell phone. So even if you're asked to stay in the hostel without cell phone, you will definitely not agree to stay in the hostel. So that's the state of life today. So it's the truly age of computers, and people use technology every single day of their lives. And there are a million reasons why technology is the greatest gift. So we can say it is the greatest gift, and at times it is also a hazard to us. So we should use it wisely. The learning and teaching today is completely different from what it was even a few years ago. So with the online education, past 2 years, everybody, all of you must have been at home. And with the, are you glad to be back in college? Or was it nice to be at home? How many of you are glad to be here? I mean, in college, not here, to be offline, or do you prefer online? Online. Offline. Oh, I'm glad to hear that. So anyway, so we have all become more experts. We have become experts in dealing with online as well as offline teaching and classes. Technology is indeed the need of the hour. So today, especially nowadays, we need technology everywhere. So raging COVID-19 pandemic, this has made it more prominent. All of us have realized that. And at times we feel that we want to go away from this technology. So too much technology has made us tired also. At times we feel that why don't we go away from everything? So that has also happened during COVID. Then technology has made research, and coming back to our topic, research, it has made research very simple, limitless, accessible, and globally affordable. And the best part is we have access to reading material 24/7. Around the year, 365 days, we have access to reading material. So this presentation is an attempt to outline the role of technology in performing academic research. So I don't want to bore you with research. I just tell you the websites or the technological instruments which you can access in doing your research. So I'll take you through the research process. You know, these are all the parts of the research process, components of the research process. So first we'll start with the problem. So all of you are familiar with this? Yes, postgraduates, you will be familiar. Undergraduates also, I think, in your theory classes, you must be familiar with this. So these are the components: research problem, literature review, then conceptual framework, design, sample type, research instruments, data collection, legal ethical considerations, data analysis, and discussion of findings, budget, and reference. So in each, what are the technological applications? We'll see. So in research problem, so when initially when you're going to, you have a research idea, you want to frame a research question, you want to have create a problem. We have access to large portion of literature from the, so immediately you'll go to the internet to look for articles. So what is there about this? When an idea, and immediately as soon as an idea strikes you, immediately you look at the internet, go for Google search or Yahoo or any search engine to look at the topic. And after that, if we will try to see if there are anything in depth about the article. So in this, and this will help you to formulate the hypothesis. So what are the tools available for this? So when you go to this, so I'll just highlight the tools available for each component of the research process. So I'm sorry, but so you know what is PICO? How many of you know what is PICO? PICO. Yeah, good. So this database, you can try it in your mobile phones later, not now. Okay. So when you open this, it will lead you to a database where you can insert your problem. Sorry, P stands for population. So which population? You identify a research question and which population you're going to study. You enter that population, and the intervention. I stands for intervention. Intervention and comparison. C is for comparison group and O is for outcome. We enter all this in this database. You will have column for that. When you enter that, you will get research articles based on this PICO format. So you'll get many articles related to your area of interest. And this is another website. I'm sorry about this. So I thought I'll show you all these databases. Okay, so this is another, but it will open in your mobile phones and it will definitely open. So these are all active sites, websites. You can use it while you are preparing for your research proposal. You can use this, even methodology. You can use these websites. I hope you will try it later. Okay. So this will give you a step-by-step overview of process using the online environment. So for preparing, especially this restore, this will give you how to prepare ideas for preparing online questionnaires. So like nowadays we are using more online questionnaires instead of offline. So what is the procedure to do an online questionnaire, online interviews? So all that you'll get an idea from this restore. So these are all free sites, open sources. Then coming to literature review. So literature review, again, you have many websites. I'll just rush through the sites. So you have what we are commonly doing is we go to PubMed, right? How many of you familiar with PubMed? I think all of us. So all of us immediately go to PubMed. So other than that, you have directory of open access journal. So where you can access easily. And other than that, you have EBSCO, Medline, PsycInfo, Sinal, and JSTOR. So all these, they are, you cannot say they are open access. You need institutional permission to open the other websites, whereas DO, the directory of open access, DOAJ and PubMed, these two are open access journals. So this is opening good. Okay. Okay. So here you can, whether you want journal or articles, you can search in all fields. You can enter and search for that abstract title, abstract or subject or otherwise. You can search. Let me see if this is opening. This PubMed, this you must be, you will be familiar, I think. So this is another website where you can get so many, lot of articles, okay, related to medicine and nursing. So coming to conceptual framework, again for conceptual, how to formulate a conceptual framework. So MSc students, you will be asked to do a framework, conceptual framework. For this also you have tech tools. So these are all the tools which we can use. CMap, FreeMind, so you have how you can formulate, you have your ideas, put your input into this and you'll get a conceptual framework. So these are all some of the websites which are available. So this is an online flowchart maker. So you are all, I think more, all the students, youngsters here, you are all technologically more flexible than us old people. So you will know, when you go through this, read this, you'll know how to use it. How to make a flowchart using this. Okay, so now after literature review, again, these are also for making mind maps and visual displays, concept mapping. So now the next one is we'll go for research design. So after conceptual framework, we have to go to the research design. So how technology can help us in doing, selecting the research design. In experimental research, so we can randomly select, so groups can be randomly selected to participate, focused on effectiveness. So this is an example. So I'll just give you an example how you can do use technology for doing an experimental study. So randomly, experimental control group can be randomly selected to participate in a study focused on the effectiveness of a relaxation multimedia program on learner retention. So we'll select two groups, give them a video for learning, video assisted learning, and then find out the effectiveness of, media relaxation program through videos and find out how it is effective for both the groups. So the control group also will view an alternate media program that was not designed to promote relaxation. So you have two groups. One group will receive a relaxation video. Other group will not receive a relaxation video. And online, you will assess the effectiveness of relaxation on media program on relaxation. So both the groups could then be tested using the same identical learning tool to test retention. So how is, after relaxation, are you able to retain better? Okay, so that is what we are going to test. So can you get the idea here? Yes? Okay. So quasi-experimental, a group of students could be selected to participate in a video conference that outlined the principles of health promotion. So again, video. So all these are how we can use technology in conducting research. So in quasi-experimental, it is semi-experimental. So here we have a video conference and the group would be selected using convenience sampling. So given a pre-test before the video conference and a post-test after participating in the conference. So instead of going face to face, so here we have a conference, we are meeting face to face. So instead in online, we have a conference and then pre-test and post. That's what we do normally in a webinar, right? So in a webinar, we have a pre-test and a post-test. So that again, we can use it as a research material. The non-experimental, an exploratory survey design could be used to investigate nursing faculty's experiences with teaching online courses. So survey. So this survey could be uploaded so that participants could complete it online. So this not only just a particular college. So if I want to get the faculty experience, I can directly get it from my college. Okay, but here we want to have a collective idea from all the colleges. How do you do it? We post it in the web server so that all the teachers from all the colleges can complete it. So this is another use of technology. So coming to qualitative phenomenology. So these are all types of designs, types of qualitative designs. In phenomenology, an educator could plan to conduct individual interviews with a small cluster of peer participants to explore their personal experience of integrated technology into their teaching. So this is, I think, is that clear? Grounded theory, researcher could plan a study to develop theory about communication process that emerged during discussion forums between instructor and students. So this in the research process, you should have already have some idea about what is phenomenology and grounded theory, just the application, how you can apply online. So instead of doing it in person, you go for online methods. Then ethnography, researcher could join online community to study cyber cultural patterns of interaction and relationship building. So these ideas, you can use it to conduct research. If you're interested, you can use this as an idea, online community. So discover an online community and find out cyber cultural patterns of interaction. Then feminist research. Feminist would explore experiences of women who are launching web design business. You see so many web design businesses. So you can find out the women experience of the women. Then action research would plan an initiative to explore needs of single mothers. So using both face-to-face and online support community approach to planning and action decisions. So all the real-time research, whatever you're doing in life, real-time, that can be done online. So how we do it? How we can use technology to do it. Okay, coming to sample. Randomization. How do you randomize? So this is a random number generator. So randomize what we do, we collect put all the sample, write down in a paper, generally in a paper, put it in a box and randomly pick up the number. But we have a generator. So if you want to select, say 100 students are there in my class, I want to select randomly 25. So I can select the lower limit. So 1 to 100. So generate how many I want to select 25 or say 15 members randomly. Okay. So this is an online technology application. So this is an easy application. So easily you will get 15 numbers. So you can select the number 2 according to the attendance register. You can select that second person, 8%, 10%. So this is a random number generator. So this is another website for getting random numbers. So this is all, you apply this in your research. Then in purposive sampling, so that is random sampling. Now coming to purposive sampling. So this purposive sampling through online. So you will invite the students to participate in online focus groups to discuss their WebQuest experiences. What is WebQuest? WebQuest is using links to search articles or books for your study purpose in the internet. So we will look for online. So this could have been done during our online classes time. So then convenience sampling. Nurse could ask clinic patients to participate in a web-based monitor study to assess their monthly blood pressure from home. So if you cannot go to the hospital to get the blood pressure, you can use this web-based study to assess blood pressure from home. Then snowball sampling from online survey. What is snowball sampling? Any idea? Yes? Yeah, sample will refer to another sample. Okay, online survey, a participant to invite a friend to also participate in the study to increase the sample size. And here, sample size again, we have other tech tools. The same thing. Okay. So this Survey Monkey, this is another, it's really a nice tool for calculating sample size. So this you can also use, researchers, you can find it useful. So now coming to the next step, instrument and data collection. So we have surveys, questionnaires. So we have web survey, online web survey sites, websurveycreator.com. So some are not free and some are free. So we have survey creators. Okay, so this again easy survey package where you can create your own surveys. So you can make it an exercise to see which sites are actually you're able to access. So this one, this is I have accessed this. So this is definitely free. Survey Monkey. You can use this to in your study. If you're conducting a survey study, you can use this Survey Monkey. It's one of the popular survey tools. And there are other websites, Inline Survey, Conjointly. Okay, so you have to test it out. So I don't want to drag the session. Okay. So and then we have eCare e-monitor interface. So this helps connect patients and caregivers by setting up home-based e-monitor equipment via serial port of the patient's computer, such as blood pressure, weight, peak flow, or glucose E monitors. So we have we can feed the readings from our blood pressure equipment or monitors, glucose monitors into the system. And this will be available to the nurse or the doctors who are away from home. So this is called as. So if you're going to do a study, you can get data through this. Okay, this is an patient e-care. It's called patient e-care. So you can send data through this. So you have to log in and you can get the data from the patients from their homes, directly from their monitors. So then we have biofeedback devices, again, other technical monitors and software for various physiological and psychological data. So this again, and also wearable health monitoring systems. So nowadays we have health bands and various electronic devices which can give you data. You can collect data through that and use it for research. Now coming to interviews. Again, online interview, web video recorded sessions. Then, what is any website? Here you have a snapsurvey.com. This is a software with mobile interviewing software facility, face-to-face interviews, by allowing researcher to use the PDA as a research instrument to collect answer to the interview questions. So this also is accessible, snapsurvey.com. Now coming to legal and ethical considerations, so morning Dr. Sudha, right? She was telling us about the ethical aspects. So for this also you have this website from where you can for online research. So what are all needed for legal and ethical considerations you can download from this website. And also there's another website, socialpsychology.org, where you can download a consent form. So sample form you can get, and from that you can frame your own ethical consent form. And confidentiality. So this is another like plagiarism. In next session, what we saw about plagiarism, all that you have to see when you're doing an online research, confidentiality and data security. So we have. So these are all some of the websites where you can find out about that. Okay, now coming to data analysis method, which is very important, which is I think most important for researchers, especially in nursing. So we have SPSS. So this all are familiar with this. Yes. So most commonly used statistical package for social scientists. So this, and then we have OpenEpi. This again is another easy software which you can use to do all your statistical calculations. So here you have everything. This is again open source. You get all the standard deviation, everything, one mean, t-test, ANOVA. So everything you can, even random number can be generated, everything in one website. It's called as an OpenEpi. And you have other web-based calculator, Vasar Stats. So this is an open source. So we are familiar with SPSS. So other than that, you have to know about these. You can try it out. Which one is easy, you can use it for your study. So we have separate web tools for quantitative and qualitative data. For qualitative, we have this WEFT QDA, and this website, you can use this for qualitative analysis. Atlas T for analyzing text, video, and audio, other multimedia qualitative data, and Hyper Research for qualitative data. And this one. And this is a very interesting Research Genie. It's a very interesting tool. So it helps you to know what kind of statistics to use. So all of us, we do a study where sometimes we are not sure what statistics to use, whether to use t-test or ANOVA or Cochrane-Back alpha, we don't know. So this tool, this helps you to use it. But only one problem is I'm not able to download this in this laptop, but I have it in my, you can, if you have an Android phone, you can download this app. I think I'll have to show it. The camera is not on. Generated. விட்டுட்டு போயிட்டாரு. நானே open பண்றேன். Okay. Okay. I just want to show how it is. Mirror image ல வருது. Okay. So here you just try to open it in your phones. You will get like this. Okay. So this you have so different types of research you can see in this. So according to, based on your research, whether it is a therapy, say, or a correlation or descriptive. So based on that, you will get what kind of statistics to use. So for this, they have given one example. So in this, for this comparative study, they have given the statistics like this. So they're given mean, standard deviation, and difference between means, median mode, and difference in median mode. This is the descriptive statistics. And in inferential statistics, between two groups, they have given, so you can see independent sample t-test, Mann-Whitney U, Wilcoxon, signed rank test. If data is skewed, and analysis of variance, and Kruskal-Wallis test. So we'll know when you're doing a study based on the information you feed, put into this, into those tables, you will get your test, what kind of test you want to do. Okay, so this Research Genie, this can be downloaded from Google Play Store. Okay, coming to discussion, findings, recommendation, implications, limitation and summary. So here we have openoffice.org and writer's block for summarizing your research. Then coming to budget, it's how to write the budget. If you're going for a grant, research grant, you can use these budget spreadsheets. Okay, if it is an academic research, so it includes the budget right from. So we have templates for budget. So which includes general expense, cost sharing, salary, and other details, food accommodation. So every typical budget categories are given in the spreadsheet, which you can use. And for coming to bibliography, so citations, Dr. Lata Venkatesan, she was talking about citation generator. So you can use a citation generator, and you have different formats, types of references. So you have MLA, APA, Chicago styles. So for different styles, you have different generators. So this one, bibliography.com, this gives in all the styles. You can cite. You can start your bibliography in any style you want. So these are all, they have a trial period of 30 days. So you can use this for generating your references. Okay. So just hope you have made a note of these websites. Okay, and this where you can go home and try it out later and use it for your research. Hope it will be useful, and especially that research genie. I found it useful. I think you can try it out. Okay. So you're all ready to go now. Okay, thank you. Thank you for this opportunity.